And so we are now live streaming on YouTube. This is the work session of the Health Coverage Insurance and Financial Services Committee. My name is Heather Sanborn, and I represent Senate District 28, which is half of Portland and half of Westbrook. We're going to go around the horn and introduce all the rest of our members today, starting with Representative Quint. Go ahead.
Good morning, everyone. My name is Tracy Quint. I represent House District 144, which includes the town of Haynesville.
And Representative Connor.
Thank you, Madam Chair. My name is John Connor, and I represent part of Lewiston.
Representative Arford.
Thank you, Madam Chair. Good morning, everybody. I am Representative Poppy Arford, and I represent the District 49, the western part of Brunswick.
Representative Blyer.
Thank you, Madam Chair. Good morning, everybody. My name is Mark Blyer. I represent District 22, which is all of Leamington and part of Buxton, Standish, and Limerick.
Representative Brooks.
Good morning. My name is Heidi Brooks. I represent House District 61, which is part of Lewiston.
Representative Melorano.
Good morning. My name is Gina Melorano. I represent House District 62, and that's part of Auburn.
Representative Morris.
Good morning. I'm State Representative Joshua Morris. I represent House District 75, which includes the communities of Turner, Leeds, and Livermore.
Senator Brenner.
Thank you, Madam Chair. Good morning. My name is Stacy Brenner. I represent Senate District 30, which includes all of Gorham, most of Scarborough, and part of Buxton.
And Representative Tepler.
Good morning. My name is Denise Tepler. I represent House District 54, which is all of the terrific town of Topsom, and I serve as House co-chair of the committee.
Representative Tepler, I think you need to write a children's book called The Terrific Town of Topsom, and then it would just be a beautiful picture book of your town.
Oh, that great idea. Now that I'm termed out, I might have time to do that.
We are being joined now by Senator Stewart, so go ahead.
Hey, good morning, folks. I'm Trey Stewart, State Senator in District 2, which is 51 communities in Aroostook and Penobscot counties, and I reside in Prescott.
Excellent. Senator Stewart, have you recovered from all of the standing up and sitting down that you had to do yesterday on the floor?
And my legs were on fire, Heather, but it was better, that way, because I spent about 7 hours in the car yesterday, down and back. So it's a good stretch.
Excellent. Yeah. For those who weren't on the Senate floor yesterday, Senator Stewart's voting button wasn't working, and we had a lot of confirmation hearings, like 30 plus confirmation votes to take. So he had to stand up and register his vote on each one. In any case, we are assisted today by our clerk, Edna Caford, who I got to meet in person yesterday, and Colleen McCarthy-Reed, our analyst from OPLA. And I had said previously, but we'll announce again, that our order of operations this morning is that we're going to pick up LD 1331, and here's some additional information from the Bureau of Insurance that we had requested our previous work session on this bill. And then we're going to pick up 1196, 1822, and 1910. And then we have a public hearing scheduled for 1 p.m. on a bill that was just referenced to our committee yesterday. So that's our schedule for the day. And so with that, I will open a work session on LD 1331. And I think I'll have Colleen just give us an update on where we had ended up on 1331 on Tuesday. And then we'll bring the Bureau over, because I believe they have some slides to present to us this morning.
Great, thank you. I think where we ended up on the last discussion on Tuesday was after talking with the Bureau and discussing the first presentation that the committee heard last week of some of the information from the Bureau's consultant that's doing some further look and evaluation at geographic rating factors. There was a motion made on the ought to pass as amended that would amend LD 1331 to prohibit rating on the basis of geographic area in individual and small group plans beginning for plan years 2024. So it would be for policies and contracts issued on or after 1/1/24. And I did draft a proposed amendment and shared that with the committee for you pending your further discussions. The motion was made, but then the bill was tabled. So you have not taken a vote on that ought to pass motion. So I think that's where you left off.
Excellent. So it's my understanding that Marty Hooper and Superintendent Chapa have some additional information to present to us. Colleen, do you have their slides to share?
I don't, but let me look. I probably might have gotten sent and I might have missed an email in the flurry of things this morning, but
There were a lot of things this morning.
Yep.
Definitely. Okay.
Yep.
Let
No,
me
it
bring
just
them
came in
over.
at 2 minutes to 10, so I did miss it, but I can pull it up and give me a
Perfect.
second. If you pull them in, I'll pull up the slides.
Great. Thank you. Good morning, Superintendent. Good morning, Ms. Hooper.
Good morning, Senator Sanborn.
All right.
Good morning.
Good morning.
All right,
So
here we are.
Colleen's going to pull up the slides. I think probably just jumping into them and having either of you present them would be most helpful to the committee.
Yep.
Marty can present them.
Great.
Thanks. Hi, I'm Marty Hooper, the Life and Health Actuary at the Bureau of Insurance. Good morning, Senator Sanborn, Representative Tepler, and members of the committee. We put together a few slides to give more information about the current situation and also looking back historically on geographic factors in Maine. So Colleen, you can go to the next slide. I wanted to present this because I think it's the best view of, if I give you the factors, and we do have those later, you have to do some math to figure out what the difference between the lowest and the highest. So and I didn't quite get a chance to, if you take off the one and just look at the numbers, it's basically a percentage. So these are the carriers in the individual market. And if you look, like, let's look at currently for 2022, the say Anthem, it's about a 30% that Area 4 is paying more than, let's say, Cumberland, because it's the lowest. Just wanted to give you a quick summary of the difference as it is now, but also historically. So it has changed. And the next slide will show us the change. I think it was easier than trying to eyeball it and look at the change. This shows the percentage change of the factors. So carriers have taken a different approach, perhaps, as they analyze their claims, their costs, their provider contracting. You'll notice Anthem has been reducing gradually over the years. Basically the surcharge on Area 4 is compared to the geographic factor for the lower cost areas. Community Health Options has made larger, less often adjustments. And as we mentioned, some of that depends on their business, the credibility, how much information do they have about what the claims cost year to year. Sometimes there's a lag before they get full information. And then I did want to cover quickly the small group. On the next slide, a similar slide showing by carrier over the years, they've made some adjustments. So you'll notice like United Healthcare was just a 4.4. They did increase that to an 18%. And then we can go to the next slide just so you can see the percentages. So once again, like I said, carriers take a little bit of different approach depending on the claims information they have and how they rate their policies. So there have been adjustments. And some of those are driven by the rate review as well. When the rates are filed, that's something that we look at and question. If they've had changes in their provider networks, they've had changes in their plan offerings, those types of things would affect the geographic factors.
Representative Tepler.
Thank you, Madam Chair, and thank you very much for this presentation, Ms. Huber. I needed a review of which year the Wakely report was based on.
Yes, it was based on claims for 2020.
Okay. Can you go through the slides again? And so that we can see that again and get a sense of 2020 as opposed to other years? Just flip, I'm sorry, Ms. McCarthy Reed, that's probably you that.
Oh, yeah, there.
Slides again.
So I will mention when rates are filed, the complete year, right? So they're filing in, let's say for 2022, they're filing mid 2021 using 2020 claims data and a little bit of indication for 2021. We might have the first quarter claims to review, but really the bulk of it is 2020. And the carriers did make some comment about, the effect of COVID, and they might have made slight adjustments if they felt that was appropriate. So when you look at the factor that is used for 2022, based on experience for 2020, if that makes sense.
Ms. Huber, it does make sense, but my sense of the Wakely report was that in order for the rates in 2022 premiums to be fair, the reductions in these percentages should have been much higher, although they weren't shown to us as a geographic factor spread. So I'm a little concerned about, we're a little bit apples to oranges on the numbers, but that the premiums should have been reduced by 20%. And I see the largest shift here is 9%. And there was an even smaller shift in some of the other insurers. So can you comment on the relationship between, why didn't those 2020 signals that scenario 0, which is where we are, right? We're in scenario 0. So it seems to me the insurers are just taking an approach of not adjusting for those 2020 discrepancies that were presented so starkly to us last week.
Yeah, I think one of the comments, and they made it when they presented, was credibility. So we have the benefit of aggregating. The carriers do not. The carriers only have their own business. So very often, especially for Area 4, there's a lot fewer covered lives, so that they wouldn't have necessarily that whole picture that we do with this study. So we were interested in digging in deeper, and that's why we hired an actuarial consultant to help us look at it. And we had other reasons too. We were, like they presented, we were looking at, were there better ways to structure the geographic areas to make it reflect the cost. And admittedly, yeah, that when we saw these results, we were concerned and we felt that we needed to check some more prior years. We're hoping to get 2021 to really dig in deeper and find out the areas and the particular carriers as well, because they do price their own block of business. They're not necessarily, pricing for the aggregate, as we mentioned. So I think that's why we cautioned somewhat, that the presentation, we have to take it for what it is. It's a general view of things, and the Bureau will look specifically at carriers and their experience when we review the rates.
Ms. Huber, you talked about the timeline being that the funding goes all the way until September of 2023. That seems very, very far away to me, particularly if this level of price disparity then perpetuates all the way for 3 more plan years. What's realistic for us to get some better numbers here or more data? Maybe not all the data that you had hoped to get, but in a longitudinal way, some additional data and some additional understanding of the trend line here with regard to those cost ratios.
We would hope to firm that data up so that we have it available for our rate review that comes round about June, July, and usually is finalized by August.
Okay.
And I just really mentioned the funding. That's based on the availability of the federal funds. It really wasn't our particular timing for what we needed.
Understood. And so at rate review this year, you would use that data and insist on perhaps greater shifts in these factor spreads. Is that correct?
Yes, absolutely.
So, and that's sort of a scenario 0 kind of model.
Correct.
Okay. All right. There's more slides, so let's keep looking at them.
Yeah, keep going, Colleen. I think the next one I've got is so this was, we talked a little bit the last work session about utilization changes, and that we were concerned that, if you're looking at the loss ratios, is it because, for 2020, there was a different reduction in how the insured were utilizing services. So we do see some differences there, but it's, it's not a easy, I'm trying to think of the best word for it. It's not entirely clear. There could be other things going on. So certainly ER room visits between, say, area 1 and area 4, there was a more dramatic reduction in area 4. So that could have caused some drop in the claims. That's not due just to cost, it's due to how much people are using those services. So I just present that because that was something that came up. I'm not sure it completely answers the question. So I hate to muddy the waters, but I did want to present that we do have this data and we can continue to look at it. We can look back, a few more years. We can also look at 2021 once that comes in. We tend to get that around about end of March, beginning of April.
Thanks. Yeah, as I read this chart, it doesn't explain the cost ratio differential at all, because those hospital days reductions in area 1 and 2, that's where the big money is. And area 4 was reduced by a much lower amount. So in area 2 and area 4 are comparable on ER visits. And we didn't see, area 1 and area 2 are priced basically the same. So I'm very puzzled because I don't see this chart as supporting a pandemic explanation for the 20% price gouging of area 4 in 2020. Do you see an explanation in here that I'm missing, or is it?
No, really like I mentioned, this doesn't completely make explanations. I really just wanted to show this is something we do have. We have it available going back through the years. Yep.
Great. It'll be helpful to look at those trends, I think, once there's more data for sure. Okay. Please proceed.
So I just wanted to mention that, where we are with our geographic factors. They're either at 3.25 or below. The highest, as I showed in the spread, is 1.4, and just the current statute as it's worded. So we don't have to focus on that. I do want to mention, and here's our geographic rating. I had this in the slides just from before. I think Wakely did a nice job of putting it in a picture for us. But those are the current rating areas that we have. I did want to mention that geographic rating only affects the unsubsidized. So subsidies are based on geographic area. So if you receive premium tax credits, you are paying the same no matter what geographic area you live in. So I wanted to make sure that that was clear. Okay, next slides. Yep, and this is just, I wanted to provide you with the actual, I updated this for 2022 because there was a few changes. So these are the actual factors that are being used and the spread from highest or lowest to highest. And this is for the individual market. And the next slide is small group. And I think that's all we had.
Representative Tepler.
Thank you, Madam Chair. I have a question around percentage of people who are in areas 3 and 4 who qualify for subsidy. Do we have a sense of that? What percentage of folks in areas 3 or 4 might qualify for subsidy on the marketplace?
I do. I don't have it right at my fingertips. I'll see if I can find that.
Thank you, Ms. Hooper. I appreciate that.
And of course, we're talking about small group plans as well, where the businesses in Aroostook County and Washington County and Hancock County would not have any subsidies for that, the businesses and their employees.
Yes.
Colleen, could you make sure these slides are sent out to the committee and the IP list so we've got them to look at as we go forward? All right. Questions for Ms. Hooper or the superintendent with regard to the presentation that Ms. Hooper's just walked us through? All right, I'm not seeing any, but it is a lot of information that's new to the committee. I had a little preview of it last night, so I knew it was coming, but I want to give the committee a chance to digest it a bit. And so as this is supposed to be our last day of work, I'm going to suggest that we table the bill and then, but with the anticipation we would circle back to it later today if possible. And so that would be my suggestion for how we proceed, to give everyone a little bit of a chance to digest Ms. Hooper's information, unless there's any more questions or committee discussion that folks want to have at this time. Okay, Representative Tepler.
Thank you, Madam Chair. I was just going to move that we table this bill.
I think that's appropriate unless I see a second from Senator Stewart. So appreciate that. But again, anticipating we may reopen this work session in the same day, given the timeline that we have in front of us, or we may not if we can't get there, but that's our hope for today. So with that, I'll ask for a show of hands on the motion in our boxes, and it is unanimous of those present. And so 1331 is tabled, and I'm going to thank Ms. Hooper and the superintendent for pulling together that additional data very, very quickly for us. And I'm going to send you back to the attendee space for now. Thank you for joining us this morning. Okay. The next bill, I'm trying to always remember the LD numbers here and the order in which I had announced them. So 1196 is what we're going to pick up next, and a revised draft of LD 1196 based on our discussions in our last work session was circulated on Tuesday. And so I'm going to have Colleen just kind of walk us through that, maybe screen share the amendment, walk us through where we are with it and how we got to that amendment, and then we can discuss from there.
Sure, here we go. So as Senator Sanborn said, this is the amendment that was distributed on Tuesday based on some of your additional discussions since the first version of this was shared with the interested parties in mid-February. The first change I would highlight, the first changes I would highlight are in Part A. You had some discussion at your prior work sessions about the definition of behavioral health care, and you had asked for the main health data organization and advocates and representatives of the Department of Health and Human Services to take a look at the definition and recommend a definition back to the committee for what would work in term for MHDO in terms of being able to gather the data that you're asking, that you would be asking them to do if you moved forward with the rest of the provisions in Part A. And so they have recommended this definition of behavioral health care, that it means services to address mental health and substance use conditions. And it would strike out the remaining language of the prior definition that was shared with you. And then with regard to the rest of Part A, at the last work session, the main health data organization had shared some suggestions for changes to the language to make clear to payers that they would be trying to gather data from them about non-claims-based payments for behavioral health care. And so the language in red would add to the data collection efforts that MHDO would be providing information on total behavioral health care related non-claims based payments and member months. And then with regard to payments associated with substance use disorder services, it would get at some of the information that currently is not available pursuant to some federal regulations, but would allow MHDO to ask for that information and have a description of the methodology used to redact those claims so they can try to get at that additional data as well. And then the last.
Oh, I'm sorry. Just if you scroll up, was there also a comment about subsection A there being too limited, and that it should be anyone who reports to MHDO, including employers if they report voluntarily?
Yeah, we could certainly do that. I mean, that happens. This language in the current law is what is in the current law with regard to the primary care spending reports that MHDO does. So that's why this is there.
Okay.
The voluntary reporting, I think, is a reflection of a Supreme Court decision that, that the data collection can't be compelled from ERISA self-insured plans. And so there are some plans that self-report currently. If it would be helpful to put that in there, we could certainly add that language.
Okay.
To reflect those employers or those self-insured plans that do report on a voluntary basis. And there are some.
Okay, I'll ask Karen Lee to answer that question in a little while after you go over the rest of the amendment.
And as a state, we can direct the state employee plan, for instance, to, even though they are self-insured, to provide that information. And then this additional language in red here just requires that payers would provide the information to MHDO within 60 days of a request for that supplemental data that I mentioned with regard to non-claims based payments and the information or claims related to substance use disorder services. So this is just trying to put into the statutory language what MHDO has suggested would be helpful to them and would help alleviate a need to sort of go through additional rulemaking before they would be able to access this information. So it would also require that MHDO notify payers the time period for which they're requesting the data and sort of the definitions of the data sets, that would be consistent with the uniformity in their data sets that are currently in place for the rule particularly with regard to collection of primary care spending data. And then the last change really just addresses a typo that was in the prior version and reflects that definition that I mentioned, the recommended definition of behavioral healthcare that I mentioned earlier. The Maine Quality Forum is responsible for sort of pulling together this report using the MHDO data, and that they would look to other states and organizations to determine the best practices for how to report the behavioral healthcare spending information back to you on an ongoing basis. So that's part A. Do you want to stop and sort of get the questions out of the way now, or go on to the part B stuff?
Yeah, let's talk about part A first. And I think you can stop screen sharing for just a minute so we can bring in Karen Lee Harrington. Yeah, there she is.
Yep, she's here.
Good morning, Ms. Harrington.
Good morning. Oh, sorry.
Thanks for joining the committee this morning. So my question at least is about that paragraph A and whether the data set is broad enough and it includes all of the MHDO data that's available. And, you know, I'd even be open to making sure that language tracks the primary care spend report. But how do you guys do that right now in terms of the primary care spend report? Is it a subset of MHDO data because that language in paragraph A is narrow?
So you were too quick because I was trying to look up the language in our rule that governs the claim submissions, because we did add language that we will treat voluntary submissions like we do any other required submission. So I'm not sure. I mean, the payers would include the non-claims-based payments or the SUD data for those voluntary submissions in their regular submissions. So it wouldn't be, you know, something separate. It would all just be part of. And I'm sorry, I'm hesitating. In a perfect world, I would want to chat with our AAG, but I sort of feel like maybe adding this would include voluntary submissions would be a good thing if
okay. Should we make a parallel change to the parallel provision with regard to the primary care report?
I think the difference, sorry, I'm hesitating. I think the difference there is our rule covers the primary care non-claims based submit. So I think that's okay. Can I have a minute to think about it?
Absolutely.
And then I can send Colleen an email while you're talking. Does that work? Or
that would be great. I think that we're way in the weeds here. So and almost a language review type of piece, honestly, because I think we all agree on what the substance of it is. So I'm happy to defer that question to sort of final language wordsmithing with the rest of the committee's indulgence, and we can move on. Thank you, Karen Lee. Are there any other questions for Karen Lee with regard to part A of the bill? All right, seeing none, I'm going to pop you back into the attendee space, and thanks for joining us this morning. Okay. Colleen, you can go on to part B, I think. And you're on mute, so we can't hear you.
Here we go. Part B of the prior version, which you can see, included some proposed changes to Title 24A with regard to health insurance carriers related to sort of prohibiting or proposing to prohibit separate credentialing processes and separate billing processes for behavioral health care, healthcare providers and other providers. But based on the discussion that you had at your prior work sessions, you sort of really focused your discussion more on credentialing and the timeline for credentialing. The revised amendment would strike out all of those previous sections related to carve-outs for behavioral health care with regard to credentialing or billing, and replace it with a section that amends the current guidelines for credentialing of providers. And so would amend the current law, one section here, which is B1, and the statutory changes are all in paragraph D with regard to the timeline for credentialing. So it would, the proposed changes would essentially require that carriers make all credentialing decisions within 60 days of a completed credentialing application. The current law would allow up to 180 days for decisions to be made, so it shortens the time frame there. It also adds an affirmative timeline for when a carrier must notify a provider that corrections might be needed to an application. If an application is incomplete, the carrier would be required to review the application within 30 days of initial receipt, and if it is incomplete, return it to the provider within those 30 days for corrections. And then at the bottom here, the underlined language in red, that if a carrier is unable to make a credentialing decision on a completed application within that 60 days, they'd be required to notify the Bureau in writing prior to the expiration of that 60 days and request authorization for an extension. In requesting an extension, the carrier would be required to explain the reasons why it's taking longer on a particular application, or if the problem is more global, they would be required to submit a written remediation plan to bring the carrier's credentialing practices in line with the 60-day timeline. So that's the proposal in Part B.
Thanks, Colleen. I'm first going to ask the committee if they have questions for Colleen about this language. All right, and I don't see any. So Colleen, I'm going to have you stop screen sharing, and I'm going to bring in Ms. Rawlings-Secunda, who has her hand raised from the Bureau, and see what she has to add for us.
Start video.
Good morning, Ms. Rawlings-Secunda. Please go ahead.
Good morning. Thank you, Senator Sanborn, and thank you, Representative Tepler and the rest of the committee. I just want to talk a little bit about the Bureau's take on the new amendments with regards to the section. It looks like a lot of it is codifying what's already in 850. And so we really wouldn't have a problem with that. I just wanted to raise a little bit of an issue that we're seeing with subsection D. So we agree that when the law says it should be 60 days, that we mean 60 days, but we're a little hesitant to take away any safety valve. So I wanted to make sure that that was brought up. The other piece of it, we were looking at something kind of parallel to this. We were looking at LD 1317, Senator Brenner's bill about prepayment audits, and some of the information that was in there, for example, about materiality versus a technicality as far as something that would hold up someone's application. But the other piece I want to talk about is the sending, the way the language looks right now. It looks like every single application that was going to be held up beyond 60 days would have to come to the Bureau along with an explanation, and we would have to approve it. I've been trying to wrap my head around what the volume of that could be, and I frankly don't have any idea. So we think it's very reasonable for the Bureau to be involved if there's some kind of a systemic breakdown. And we have done that kind of behind the scenes on an ad hoc basis. But definitely concerned about the amount that we could be seeing if this is for every single solitary time that something's held up beyond 60 days. So with that, I'd be happy to take any questions about what our credentialing process looks like now.
Thank you. Are there questions for Ms. Rawlings Secunda? So my sense of it, Ms. Rawlings Secunda, is that if the carriers are following the rules, then there won't be any reports at all. There's no reporting requirement to you whatsoever. But my concern is that when the cascade started to happen in 2020, there was no requirement that they talk to you about it. And so you were receiving sort of ad hoc anecdotal reports from me and others who were talking to the provider community, but didn't really have a tool to leverage any kind of coordinated response from the insurers. And they fell farther and farther behind rather than jumping on a remediation plan, early in 2020. So can you reflect on that?
Yeah, I mean, I understand your concern very much so. And I guess what I would say would be going back to if there is some kind of a systemic problem like we've been seeing, that could be something that we look into, certainly, and that could be something that could end up being part of this, but our concern is more the one-offs.
Okay. I'm trying to, so I know that with regard to like prior authorization, there are strict deadlines, and I'm trying to wrap my head around why, if an application is completed, because we're only talking about completed applications, why there's any reason why a one-off situation should take more than 60 days on a completed application. I mean, it strikes me that you would just reject it, right? You would just say, nope, it doesn't look on the surface of these papers like we can credential this applicant, and so we'll reject it. And then the appeals process kicks in, and then there's timelines for that. My concern is this sort of hanging process where you're neither approved nor rejected, and therefore have no appeals process. And if there's a high volume of individual cases of that happening, that strikes me as another problem that I would think the Bureau would want to know about.
I mean, I guess that comes back to if there's a high volume of that's indicating that there's some kind of a systemic issue, which we would then want to know about.
Right. So I can't even conceive of what the individual application problem is, I guess. I feel like it's either a systemic problem or it's not a problem.
And I admittedly don't know. I mean, that would be a question for any of the carriers if they're in attendance today.
Okay, and I did see Ms. Ossenfort just raise her hands in response to that. So let me see if there's any other questions for you. And I'm not seeing any hands up, so I'm going to move you back into the attendee space. Thanks for your contributions this morning.
Thank you.
And I'm bringing Ms. Ossenfort across the divide here. Good morning, Ms. Ossenfort.
Good morning, Senator Sanborn, Representative Kepler, members of the committee, Chris Ossenfort with Anthem Blue Cross and Blue Shield. Just to respond to Senator Sanborn's question, one of the reasons it can exceed is we have to verify admitting privileges, and we rely on third parties to provide that information. So sometimes we were using sort of a clearinghouse that they started having issues and we had to go to hospitals directly to verify admitting privileges. And obviously in the middle of a pandemic, they had a lot of things on their plate, and responding to those types of inquiries wasn't necessarily the highest priority. So that's one instance where we are required to rely on external sources that don't have the same timing requirements that we have. And we would hate to deny an application just because we haven't received that information. So one option might be to allow us to extend for 30 days in that type of situation where we've not been able to verify credentials or obtain other information, rather than denying and having to require the provider to reapply. And those are the types of, sorry.
So Ms. Osiport, I'm trying to follow the ball here. Would a completed application ask the provider to indicate which facilities they had admitting privileges in?
I'd have to go back and look at the form, but we're required to verify it regardless. So we have to confirm with, hospital A that Dr. B has admitting privileges there.
And you're required by whom? The Bureau?
Yes,
Rule 850?
by Rule 850.
Okay. Thanks.
Our folks did suggest that there are ways to streamline that. I can't say I fully understand what they told me, because they said that rather than verify, to allow us to use the standards for accreditation, which I'm not familiar with. So that's the part that I'd have to get more information on to bring back to the committee. But
in other words, that we could change that provision of Rule 850 in this credentialing statute in order to streamline the verification of credentials.
I think so, but as I said, I need to make sure I understand what they're trying to tell me before I can convey that to you.
That seems reasonable to me as well. I mean, I would expect these professionals to know where they have admitting privileges and be able to provide in writing in an application that information without needing bureaucratic, verification that they aren't committing fraud on their application to an insurance company. That seems odd to me that is required. So some kind of streamlining there certainly seems reasonable. Representative Evans.
Thank you, Madam Chair. Ms. Osiport, one question. Is your credentialing done in-house or is it contracted out?
I believe it's done in-house, except for, like I said, we use third parties to verify admitting privileges and things like that. But the review is done in-house, the review of the application.
Is there a turnaround time on how soon the reviewers, the outside reviewers, have to get that information back to you?
Well, we have to comply with the 60-day requirement, and we generally do over the past year.
But do they have a requirement to get it
an
back?
An internal requirement?
An external requirement to get it back.
So the external requirement is established in the statute for 60 days. Ability to extend that if we need to, but the general expectation is 60 days.
Thank you.
So Ms. Osiport, if we were able to track down this requirement in Rule 850 of this external verification and simplify it as your folks suggested, but we don't, by both of us either, quite know what that means. If we were to do that, it strikes me that then this 60 days doesn't rely on external sources of information, but just the completed application and whatever your internal review structures are for that. Is that accurate?
I believe so.
Okay. And Ms. Peltro's letter to us this morning suggested a concern that this wasn't going to fix anything because everybody was already mostly complying with the 60 days, and that it would just add a reporting requirement. But it strikes me that there's no reporting requirement as long as everybody's complying with the 60 days. No one would ever make a report to the Bureau because there's nothing to report. Is that how you see it as well?
If you're complying, yes, but if you encounter issues as we encountered, then, and my understanding is that we're not the only one, although we certainly received a fair amount of attention for it. Then there could be significant volume of requests for extensions. I think we do meet quarterly with the Bureau of Insurance. They could ask us or the committee could send a letter asking them for us to report on our metrics. Are we meeting the 60-day requirement? If not, something along those lines would be less than in statute, but a way for the Bureau to monitor what's going on for those types of things.
Mm-hmm. Representative Tepler.
Thank you, Madam Chair. Thanks for being here, Ms. Ossenfort. I'm just wondering if rather than changing Rule 850, we could ask you to include in your contracts with the third-party verification entities that they comply with the time limits as well.
I can look into that. I'm not familiar with the contract. But again, whether it's us or whether it's them, during the pandemic, hospitals, ultimately it's the hospital's got to respond to somebody about whether or not the person's credentialed. So I'm not sure it matters who's asking. Just it's a workload and staffing issue for them as well.
So I guess I need to understand whether or not there has been any kind of problem with credentialing before the pandemic became a big issue for hospitals.
In terms of responding to requests for verification?
Yes.
Yeah, I don't think it was a problem on a regular basis. It might occasionally been a problem, but I'm not sure it was a problem on a regular basis, but I'd really have to go back and check with our folks to confirm that.
Okay, but it was occasionally a problem.
Yeah, I mean, people don't always respond in a timely fashion.
Well, people in this case would be your people.
No, people would be staff at the hospital verifying privileges.
So you were turning to hospitals to verify privileges before, or relying entirely on the third-party agency?
We were using the third-party vendor, I believe, and I'm not sure it's a clearinghouse, or vendor, but the hospital still has to respond to whoever is asking, whether it's us or the vendor. And sometimes I don't think it was, an ongoing problem, but I do believe that it might have been on occasion.
All right. Thank you for all this information. I appreciate it.
Colleen, I don't know if you have, while we're talking, brought up Rule 850. I know I did.
I did. Yeah, I have it. Yeah.
So it may be worth screen sharing page 14 with the committee just so that we know what we're talking about. Do you want to go ahead and do that? We can leave this Ossenfort in the meeting for now, but I think it would be helpful to the committee to see that.
Sure. Let me change my view. So I'm looking at the first page.
Actually, it's you
want me to do 2 pages?
No, I have a big screen, so I could see all, but my colleagues probably with one screen wouldn't be able to.
Yeah. So 14 is where credentialing starts, but the verification is on 14, which there's part of it. Is this too big, maybe? Let me see. I don't know. This might be, well, no, that's not
too small.
Too small. I'll do it a little bit bigger, but you could see both. Well, I don't want to.
There we go.
Yeah. So there's 2 pieces of verification, I think, as you can see in subsection 8, primary verification of the license, the hospital privileges, the DEA certificate, specialty board certification. So that this, I think, would apply to an initial application.
Got it. Yeah, so it strikes me the license is probably something you can just look up in a license database under 8A. And perhaps the other 2 are in a C and D might be in a database somewhere as well. rather than having to call someone on the phone or get them to respond to a specific inquiry.
Senator Sanborn, can
Mm.
I'm curious how primary verification is defined and whether it could be potentially defined as having a notarized statement from the credentialee regarding.
I'm bringing in Ms. Rawlings Secunda, and she'll be here shortly, I think, to help us understand how this is interpreted by the Bureau.
Thank you.
Yep, I'm going to leave the screen sharing up.
Okay. Yeah.
But when Ms. Rawlings Secunda, when you arrive, go ahead and help us understand this piece of 850.
I can't speak off the top of my head to Representative Tepler's question.
Okay.
What I was just looking up, because this section of 850 with the primary verification predates my time at the Bureau. So I don't know why it's in there, but I will say, looking at the National Committee for Quality Assurance, NCQA, this is one of the national accreditors for the health plans. Their verification of credentials includes a current and valid license to practice, a valid DEA or CDS certificate if applicable, education is training as specified in the explanation, board certification status if applicable. And the fifth one, and I think this is interesting, says work history. So I don't know if that's connected with the hospital privileges one or if that came out of something else. But Ms. Ossenfort referenced at one point, there was the question mark of accreditation. I might just be making the waters muddier by bringing this up, but I just don't know what work history means in this scenario and how that might relate to hospital privileges.
And I missed it because as you were reading, were those things that had to be primarily verified, primary verification? Or were those things that had to be obtained?
It just says timely verification. It does not, let's see, hold on. Let me poke around for just a minute here. I
think subsection 9 gets at job history, which is the second piece of it.
Yeah. Okay. Yeah,
in Rule 850 as I read it, but
I can't see anything in my super quick reading of the accreditation standards of saying whether this is primary or not.
Okay.
Excuse me, Colleen, is there a definition of primary and secondary verification in the statute?
So I think primary verification is going to be like from a primary source, like you go directly to the person, to the hospital to find out that to verify that other person has privileges. A secondary verification would be like a national clearinghouse.
I believe that's correct, but it doesn't actually say that in 850.
Right.
So asking a person to submit an affidavit or a notarized statement would be tertiary verification. I guess I'm a little confused.
Well, it wouldn't be verification necessarily. It would just be taking the person's word for it. Verification suggests that you're questioning the applicant's veracity or verifying the applicant's veracity. I just brought Mr. Yardley in as well. And so Mr. Yardley, go ahead. He might not be here yet. When he gets there, he can go.
Thank you, Senator Sanborn. Representative Tepler, I'm Ben Yardley, Senior Attorney at the Bureau. In section 5, there are some definitions, and this is of Rule 850. Primary verification, and let's see what page to go to, page 8 it looks like, means verification of a health professional's credentials based upon evidence obtained from the issuing source. So you go straight to the specialty, the doctor's specialty organization. And secondary means verification based upon evidence obtained by means other than direct contact, such as certificates provided by the applying health professionals. So I think that would be a copy of the degree, would be secondary verification. And then if you really wanted to be sure, you'd go straight to the university.
Okay. So Colleen, can you stop screen sharing for a moment? So I'm going to make a suggestion, committee, just so that we can kind of get ourselves untangled from this. And what I'm going to suggest is that we keep the language of the statutory amendment in Part B as presented, but that we also add unallocated language asking the Bureau to review Rule 850 with regard to verification of credentials, and to see if there's any changes that should be made, taking into account the quality recommendation, the federal, whatever the item was that Ms. Rawlings Secunda was just reading from, the national standards, and in consultation with the insurers who practice this and run into the barriers on the ground. So that basically with a goal of cutting unnecessary red tape that provides barriers to providers being able to practice or being able to be credentialed by the insurers. Does that make sense to the folks from the Bureau to sort of add that review?
I think so, yes.
Okay, perfect. Colleen, do you know how to draft what I'm saying?
I do. Do you want to review and sort of report back next session, or do you want to authorize the Bureau to change the rule if it's necessary?
I think that they would be able to change the rule if it's necessary, right? Just through their rulemaking.
They have existing authority. Yeah, the only caveat is
it a major substantive?
I believe it's major substantive.
It is major substantive. So if you wanted to allow them to do routine technical for this, you would have to put that in the unallocated language.
Yeah, I'd love to have this one go into effect without having to, wait or anything like that. I think this is just a good governance kind of piece where if this is a roadblock that's causing issues, we can probably review whether it's something that could be lowered without hurting patient safety or quality.
Yep.
Does that make sense?
Okay, that's fine. So it'll be routine technical. If they do the rulemaking, even if it's routine technical, the legislature gets notice of that.
Right.
So
correct.
Be all set there.
Okay, great. Representative Evans?
I meant to take my hand down, but I didn't see Mrs. Ossenfort still there. But I'm concerned about the external review. Because most of the hospitals in Maine, just about all of them, use CAQH. And you do the initial application, fill out the whole paperwork, and then it's updated just about every year. So I know we have to do that, and that's a requirement on our medical staff.
So it's interesting that you should say that, Representative Evans, because I just heard back from my folks asking them to clarify what they meant by deferring, and this may be better left to the process that Senator Sanborn just outlined. But the response I received was that all other states that follow NCQA accreditation standards that allow us to use the provider's CAQH application that they do. So Maine law doesn't allow us to do that currently, but I think that's one of the things we will explore with the Bureau.
Because most of them are already doing it.
Great.
Yep.
I have no idea what those words just mean that you and Representative Evans just exchanged, but I love them. I think it's exactly the right direction, and I think we've uncovered a little piece of bureaucratic red tape and the corner of the statute that could probably, or of the rule that could be improved. So
It's the Council for Affordable Quality Healthcare. And you have to do it every year, update it every year.
Fabulous. I love it. Is there any further committee discussion or questions for our guests? All right. We're going to get a provider representative in on the act. Hang on just a second. Ms. Harvey McPherson is going to come over and join us. We're getting close here, folks, though. I think we're cruising toward a vote on this one. Ms. Harvey McPherson, welcome.
Oh, good morning. Thank you, Senator Sanborn, committee members. While you are discussing the credentialing section of the bill, I do want to share with you from Northern Light Health's perspective, we support the changes in Section D, but it's not clear to us why the language regarding parity of credentialing standards between behavioral health professionals and other professionals was struck from the bill. And so we do have concern that the parity component has been struck. Section D talks about the efficiency of the process, but it doesn't address parity and standards.
Do you mean parity and standards with regard to commercial insurers, or was that in the main care section of the bill?
No, well, it was in 24A credentialing, and it states that a carrier may not use a credentialing process for a provider of behavioral health care services or a provider that integrates primary care with behavioral health that is separate from or more restrictive than the credentialing process used for any other provider.
Right. So the approach that the committee had sort of initially thrown out there, I think we felt might be unworkable in the sense that the separate from piece we weren't sure what exactly we meant by that, because you probably are going to credential, LCSWs through one person's desk and physicians through another person's desk. And we weren't sure if that was separate. And we also weren't really sure. We know that there have to be objective standards for credentialing. And so I wasn't clear on how, and that those might be different with regard to physicians versus LCSW. And so I wasn't really clear on what less restrictive or more restrictive than meant in that context. And so we felt like it was really the delay and the timeline that were the loophole that was a problem, as opposed to that there were actually not credentialing folks. The problem has been that they're very slow to credential folks. So that we pivoted a bit in our approach in this particular draft. And that's sort of my summary of how we got to this particular form of Section B of the draft. I will mention that we have dropped Section C of the draft, which was all to do with main care. And that is out of deference to the fact that this committee really doesn't do that. And we felt a bit out of our depth and that we shouldn't go there, that we hadn't done the diligence that we needed to do to add Section C to the bill. Does that help to explain how we got where we are?
Yeah, it does help explain. I just had, when I vetted this with our contracting and credentialing and Acadia teams, they all questioned why would we take, kind of a parity component out of the bill. So,
and we're not taking anything out of current law with regard to parity. We're just taking it out of our proposed amendment. Right. Yeah. Representative.
Yes, thank you, Madam Chair. I wanted to add a little something to that. The distinction between individual credentialing and facilities credentialing was a complex one. And because the facilities credentialing was happening in DHHS, and I think that was one of the issues that we had a lot of difficulty with and felt out of our depth on in terms of this bill.
Yeah.
Okay.
I agree.
Thank you.
Thank you very much. Thanks for asking the question. It might have helped others understand our approach as well. All right. Are there any other questions for any of our guests before I move them back out of the committee room? All right, I'm going to move folks back. Thank you for all for joining us. And move folks back. Oh, someone else moved everybody back. Okay. So I'm going to look to the committee for a motion. Does anybody have a motion? Representative Tepler.
Thank you, Madam Chair. I move ought to pass as amended.
Can you, with the amendment as I described it in terms of directing the review of 850?
Yes, with
Adding that.
unallocated language that directs the Bureau of Insurance to examine Rule 850 and eliminate any extraneous red tape that doesn't impact national quality standards.
Okay. Is there any further, is there a second for the motion? Representative Arford, is that a second? Great. So it's moved by Representative Tepler, seconded by Representative Arford. Is there additional discussion on the committee about this bill? Seeing none, I think we're ready for a roll call.
Okay, thank you. Senator Sanborn.
Yes.
Senator Sanborn, yes. Senator Brenner?
Yes.
Senator Brenner, yes. Senator Stewart? Representative Tepler?
Yes.
Representative Tepler, yes. Representative Alford?
Yes.
Representative Alford, yes. Representative Bleier?
Yes.
Representative Bleier, yes. Representative Brooks?
Yes.
Representative Brooks, yes. Representative Connor? Representative Evans?
Yes.
Representative Evans, yes. Representative Matheson? Representative Malorano?
Yes.
Representative Malorano, yes. Representative Morris?
Yes.
Representative Morris, yes. Representative Quinn?
Yes.
Representative Quinn, yes. 10 members of the committee voted affirmative, 0 in the negative.
Okay, thanks. And so with that, and we thank Representative Zager for bringing us the bill and all of the folks who worked over the interim on 1196. It's had quite a journey, but I think has delivered some good reforms and will deliver some good data to us as well that future legislators can use. We'll next open a work session on LD 1822. And I'm gonna have Colleen present to us the amendment that was circulated on Tuesday and give us a recap of where we are.
Sure. So LD 1822, this was a bill originally brought to us by Representative Morales that would have prohibited all cost sharing by insurers for behavioral health services. The proposed amendment that was shared on Tuesday sort of came out of the previous discussions you've had during your work session about trying to focus on a concept of parity between the co-payments for primary care services, office visits, and behavioral health visits. And you might recall that under the clear choice plan designs that were enacted, or some of the language that was enacted with regard to that, there was a requirement in the statute that certain primary care office visits and behavioral health office visits have no cost sharing. The first visit would have no cost sharing, and the deductible or co-insurance for the second and third visits would not be applied by carriers. And this proposal builds upon that and adds a new section of the statute, which is in section 2, which would require for plans of all sizes. So it would apply to both individual and group health plans, not just to small group plans, but beginning with plans with an effective date on or after January 1, 2023. Coverage must be provided without cost sharing for the first primary care office visit and the first behavioral office visit in each plan year. And the deductible may not apply, or coinsurance may not apply to the second and third visits in a plan year. Additionally, it tracks the current law, but then following the second or third primary care or the second or third behavioral health visit in a plan year, the health plan would be required to apply the same copay amount to primary care office visits and behavioral health office visits, and must count any copays toward the deductible for those types of visits in the same manner. It uses the definition of behavioral health that tracks from what we just discussed in LD 1196. It would mean an office visit to address mental health and substance use conditions. And then, like the current law, it maintains that exception for plans offered for use with a health savings account because of the federal guidelines by the Internal Revenue Service as to what benefits are permissible. And it also includes language, as is in the current law, authorizing the superintendent of insurance to adopt rules if necessary. So that's the proposal to replace the provisions of LD 1822 with regard to cost sharing for behavioral health office visits. And then the second piece of the bill comes out of some of your additional discussions about parity and what parity means and compliance with federal and state mental health parity laws. And the second section of the proposed amendment is modeled on model legislation that's been developed by the Kennedy Forum and was shared with you previously, and it has been adopted in a number of states. And it relates to some additional work by the superintendent of insurance to ensure plans comply with the federal and state parity laws, and also would require some reporting by carriers to the Bureau of Insurance about their compliance, and it does have a focus on what's called non-quantitative treatment limitations, which would be things like prior authorization and utilization review and step therapy, for instance, possibly the types of things within a health plan or processes that might have an impact on compliance or mental health parity. So it would require reporting, and it's based on, as I mentioned, this Kennedy Forum model, and it was part of previous legislation that was considered by the committee in the 129th legislature, but not enacted at that time. So that's the draft. I'm happy to focus on anything specifically that you would like in the language. I do know that you also received some additional comments this morning or right before you started from carriers, and I forwarded that information to you.
Thanks, Colleen. We did receive a couple of comments on this draft that I wanted to respond to, and it might be helpful to keep screen sharing.
Sure, I'll go back. Yep.
So we did receive a comment from the carriers that suggested that there may be plans, although I have certainly never seen them, where behavioral health visits had copays that were less expensive currently than primary care visits. I was a little surprised by that because I've certainly never seen that plan structure, but the suggestion was made that the primary care, that the copay for a behavioral health office visit should be no greater than the primary care office visit. And I think that's a fine suggestion. And I would adopt that suggestion. And then the second concern was with regard to proprietary information of insurers in their reports under the third part of the draft, or the section 2 of the draft. And I had Colleen do a quick review of some of the other states that have implemented this particular Kennedy Forum model. And she found that the 4 states that she looked at did have some protections for non-public confidential information contained within the reports. So I guess I would ask that for language review on this, that she bring us back some proposed language that would be a FOA exception, and then we would have to run it by the Judiciary Committee, as well as I've had lots of experience doing now with certain of our bills in this committee and with my dual role on both committees. And I would just submit that exception should be very narrowly drafted, but should follow other states that are using this model. I think you can stop sharing now. Additional comments from the committee or questions for Colleen or for me? All right, I don't see any hands up. Representative Arford, go ahead.
Oops.
You're on mute, Representative Arford.
So I'm not confused. I just want clarification. The current 2022, my understanding is Clear Choice plans do not require any pay down on the deductible for behavioral health outpatient visits. So how does that match with what the language we have here? And then I'm assuming Marty Hooper, could we call her in for to respond to this?
I think it's actually Joanne rather than Marty.
Okay, because I spoke with Marty yesterday and learned that, in fact, they also have, and this is a little bit complicated, and that's why I would like one of them to comment on it. On the Clear Choice plans and the Silver plans, they have a mechanism whereby, based on the person's income, and somehow these calculations are all made when the person applies and registers for a plan, based on their income, that determines actually what their behavioral health copay is. That, in other words, the maximum may be $30 or $40, but if they have a lower income, they may be charged only $10, $20, or $30. And there's a term for that. And I did not write it down. I apologize, but I just want to make sure the committee is aware of this. And secondly, how that intersects with what we're doing in this bill.
Right. So those are cost share reductions, and I'll have Ms. Rawlings to kind of follow up.
Yes, that, as Senator Sanborn said, those are cost sharing reductions or CSRs, and it does mean there's a reduced copay. I'm trying to communicate with Ms. Hooper right now, so just give me one second.
Meeting. I can bring her in and we can communicate with her on screen if you like.
Well, the Clear Choice plans have the same copay, but we did get some carriers saying that due to parity requirements, they were going to provide behavioral health visits with lower or no copay. But I don't have any more information than that at the moment.
Okay. Ms. Hooper is joining us and she can give us more information on that. And is this, Ms. Rawlings-Secunda, you're talking about the Clear Choice plans?
Yes, specifically Clear Choice.
The second year of Clear Choice, like this, the new plans, so they're not on the market yet?
Correct.
Okay, great. Ms. Hooper, can you follow up?
Yep. Hi, I'm Marty Hooper, the Life and Health Actuary at the Bureau. I might have missed a few of the comments as I was coming through, but I can mention, so we do have Clear Choice plans available right now, for this year, and they do have the same copay for primary care visits and behavioral office visits. And as I discussed with Representative Arford, when we were talking about the cost share reduction plans, I just wanted to emphasize that, based on income, there is a plan available you have to purchase the silver plan, but it does have reduced co-pays down to, for example, a $10. So it's a little bit, confusing. And you can go on coverme.gov and do a compare plans and see the plans. And if you put in the right income level, then it will bring up the cost share plan structure.
Yep. And of course, again, those cost share reductions are only applicable in the individual market, not in the small group market, which would be, as well as the large group market, which would be impacted by this this proposed statute.
Yes.
Okay. Ms. Representative Arford, did that answer your questions or get the information out that you wanted the committee to consider?
Well, the other part is, does that in any way intersect with the language in this amendment, in the sense that we are looking for parity? And does that mean that the primary care copays will reflect the same amount for these cost sharing plans on the exchange, or is this completely non-related?
I'm not sure who should answer that. Ms. Hooper, can you give it a shot?
Yeah, and my quick reading of it, I believe that it just conforms to what we have in Clear Choice right now.
Right. Okay, that's my understanding of it as well, as this would put in statute some of the things that have been developed in the plans, but it would extend their reach. Representative Morris.
Yes, thank you, Madam Chair. As I'm reading this draft language, it looks like we're going back to LD 2007 from 2 years ago and moving large group now into this with the co-pays and so forth. And if I remember correctly, there was a reason we exempted them a couple of years ago.
Okay. Shall we have someone comment on, is there a question there, Mr. Representative Morris?
Yes, isn't that so? I guess that we exempted them a couple of years ago. If Colleen, if anyone remembers that discussion, I think it had to do with the difference in it being experience rated as opposed to a community rated system. So I thought we were, we did all that to try and help the small group and individual markets get more people in. That this is obviously going to impact larger businesses that have not had the opportunity to weigh in on this particular amendment.
Okay. I mean, so we aren't talking about self-insured plans, just to be clear, only talking about large group fully insured plans.
Correct.
As far as why we limited the applicability to small group and individual plans in the Made for Maine Healthcare Act in that particular section, I don't know. I don't recall the specific reason why that section was limited. The Clear Choice plans, which is a separate section of the statute and which we are not changing, were limited to the individual market and the small group market, and then were delayed, I think, in implementation for the small group market for a year pending merger discussions, if I recall correctly. And so this is sort of a separate provision of the Made for Maine Healthcare Act. And honestly, I would consider it a little bit of a plan design experiment. What happens if we require this type of thing? And the plan design experiment, I think, has been quite successful. And in fact, it looks like the carriers are suggesting even lower copays for behavioral health in future plans in order to meet what they now perceive to be their parity requirements for behavioral health, which seems like a win to me. So I think you asked a political question, so I'm taking the liberty of giving a political answer as opposed to, because I don't think there was a rationale that was based on.
Okay.
I don't think that there was a rationale that was based on something about, you know, it's experience rated or something. We're talking about the plan design as far as what the copays and out-of-pocket costs are for the members of the plan, and whether there should be parity or first visit free, 2 visits before the deductible type of plan design for everyone, or only for those who buy their plan through a small group or a individual plan. And it feels like the right time, given the mental health crisis, for us to make that particular plan design requirement a bit more broad. Does that answer your question?
A little bit. Like I said, I have concerns about moving this in, at least without getting some comment from people that will be affected by it. Because as you know, we can make this change into a large group. They didn't, you know, they testified, I think, on the original bill. This is a whole new amendment. This is obviously a new concept for them, not just on the behavioral and mental health piece, but also on all the other health pieces that, again, initially we exempted, you know, large group plans from that because we were trying to get to sort of the clear choice designs of, you know, these 12 choices. And I'm not sure it fits well in large group. At least I'd like to get some feedback from those that are in those plans and those that buy those plans about what the impact of this language would be on their costs.
Okay. And I guess just to respond to that, Representative Morris, I do think that this bill is actually less different from its original form. It's certainly on the same topic, which isn't really true of 1196 or some of the other ones done recently.
No,
but this one really is on the same topic, and certainly the insurers opposed the original version of 1822. And this approach, I think, is quite responsive, actually, to the testimony that we heard at the public hearing, in the sense that the request from the sponsor was that we eliminate all copays with regard to behavioral health and take the New Mexico approach. And the committee has backed away from that more radical approach to the mental health crisis and is proposing this extension of what we did 2 years ago instead. And so I guess in terms of like just the sort of germaneness and the topics and how a committee can transform a bill after public hearing, but you know, still have those insurers, because it really is the insurers. It's not like individual employers that would necessarily want to weigh in on this type of an issue. Anyway, I think they're here and they're listening, and they've certainly been on notice about the direction we were headed with this. And I see Mr. Sultan has his hand up, and I'll call on him after I talk to Representative Tepler.
Thanks. So I just want some more clarity from Representative Morris on what he's asking. What I think I hear you asking, Representative Morris, is do we have concerns about this driving up costs for employers buying in the large group market, buying health and coverage in the large group market? That is what I hear you asking. And I think that one of the things that we need to acknowledge is that rate setting is part of what our Bureau does. And so I think that they may want to weigh in even after Mr. Sultan.
Yeah, no, let's go to that question right now. Ms. Hooper, you know, can you speak to this issue of the large group and whether it would be a plan design question or more likely to impact rates?
Yeah, I guess I'm not following exactly what the question or the concern with large group is. I mean, if this requirement were to be put in place, it, yeah, very well could impact rates. because the carriers certainly, price out their plans based on their benefit and cost share structures. And then, yes, there are, large groups that are experience rated because they have enough insured lives. So there's a balance of the rates catching up with the experience. But I think certainly that if they're anticipating that those rates should be higher to cover those particular benefits, they would implement that increase, and then as experience came in, they could make adjustments. I don't know if that exactly answered the question.
I think it does. I think, I guess I'll ask it more directly. Right now, large groups are not required to do what is in this for any sort of, they're allowed to, because when they're building their plan, they're looking at what their specific members and what their specific employees might need. And as you know, once we put a mandate in it, let's say, and we say, this is what you have to do, they have to build that in. And then the second part of that is, then they have to look at other parts of their health insurance plan to decide, are we just going to let this, let the rate tick up, or do we have to look at other parts of our plan that we may need to require either a higher cost share or reduce a benefit in another area of our health insurance plans. So I guess that's the reality of us enacting this and putting it into large group markets.
Yeah, so I think what you're getting at is that, say, a large employer, similar to the state employee plan would say, we only have this type of budget. So rather than taking a rate increase, we would rather you reduce benefits in another area. So a large employer would negotiate with the insurance carrier to create a plan that was within their budget, I guess.
That would be a self-insured plan, though, wouldn't it, as you're describing it, Ms. Hooper?
I think an insured plan would do that as well. I'm speaking from somewhat limited experience because we don't approve the rates for large group plans. But my understanding is that, if there's an employer of a certain size, that they can work with the carrier to develop a benefit plan that meets their needs or their ask.
Okay. All right. I'm going to bring in Mr. Sultan because I said I would. Good morning, Mr. Sultan. Go ahead.
Thank you, Senator Sanborn, and thank you, committee. I'm Charlie Sultan. I'm here on behalf of Cigna Healthcare. I will tell you, and I can't explain all the details and so on, is that this application to large group is incredibly problematic for us. It will likely have to deal with a multi-million-dollar system changes or just a huge operational impact. It's important to understand that this is really changing how things are looked at. Copays don't apply to deductibles. So in order to do this, as you've got it drafted, it would really have to be across all service types and not just a primary care provider or behavioral office visit. So it's going to increase expenses and possibly raising premiums. Platforms that we use to deal with this are different at times between behavioral health and core medical claims systems. So there's some operational issues there. There are other states that we still encourage you to look at where you could look at preventative services being allowed with zero cost share and use some, as a potential solution is to add a mental health preventative service at zero cost share. You can look at Colorado perhaps as one example. So there's some different things you can do with that would get around how you have it drafted that really is problematic. as drafted for application to large groups. So we're just letting you know that it is large, complex, problematic, and would have some impacts. And it certainly would apply to large groups, not just self-insured plans, because as Marty said, large employers look at their cost and they do tailor their plans to try to keep them affordable so they can provide the insurance to all their employees.
I hear you with regard to the application of co-pays to the deductible. That is an odd provision. I think the reason it's in the draft is because it was in the Made for Maine law. Marty, can you speak to that at all? Do you know why it's in the Made for Maine law, or what happened there? Because that is an odd little twist.
Yeah, I can't really speak why it's in. I'm agreeing that the reason that we built that into our clear choice and why it's there is because it is in statute. But I can't speak to why it was put in the statute.
Yeah, I can't either. Though I was here for it. It was in the original draft of the statute that we got from the executive.
It
chief.
was, yeah, I just went back to confirm that, but it was in the original bill.
Yeah, so it wasn't something that this committee came up with. It was something that was sort of in the original bill that we didn't take out. I think when we passed LD 2004. And it is a bit aberrant. I would agree with you, Mr. Sultan, that it would be weird, and it's not usually how the accounting for things works. So I appreciate that critique. Is there further discussion on or questions for Mr. Sultan or Ms. Hooper or Ms. Rawlings Secunda? Representative Morris.
Thank you, Madam Chair. I actually have some questions on kind of the second section because I know it deals with federal mental health parity laws. And I think a lot of it is, as I understand it, we're already required to follow any federal laws. And I guess I don't know if you guys, I would ask the Bureau, would they need this section to be able to implement the parity piece, or how is this section necessary, or can you already do this within existing law?
So to respond, my understanding, like subsection 3, basic, the implementation of the parity law. Yeah, we can already do this with existing law. Some of the stuff that's subsections under section 3, we're a little bit concerned about, particularly the piece about the market conduct exams, specifically being about parity. We obviously do market conduct exams every 5 years. We're very nervous about boxing in to say this is what the topic has to be, because we don't know 5 years from now or 10 years from now what we're going to be looking at. And so we definitely would love to keep that flexibility that we currently have. The other piece of the reporting piece that comes from the Kennedy Forum, the only concern we have about this, I mean, with the information that is being sought is obviously really good information, and the other states that have taken on the Kennedy Forum model are looking at this. The only concern that we have is that for us to aggregate all this information and report it to HCIFS might require a fiscal note, because we would probably have to have a consultant do that so that it's in a way that makes sense. You know, we don't have a lot of experience in things like the non-quantitative. And so to have someone who could actually look at that, make sense of it, and then present it to HCIFS, I think would probably require an outside consultant. So that was a very long-winded way of answering your question.
Thank you.
Well, so let me let me draw on your answer to that question and reframe it a little bit, which is to say, you do have the current authority to implement the federal parity standards.
Yes.
But you have not developed expertise in-house or done enforcement with regard to non-quantitative parity.
Thank you for asking that question, because let me clarify. So we're currently doing a market conduct exam that involves looking at parity. So, but we are not in-house doing it. We've contracted it out, is my understanding. And if the staff listening to this want to correct me on that, that would be great. What I was trying to get at is that if the reporting piece in section 4, if that becomes an annual thing, then we would definitely need some help with that. The last time that we did, not market conduct level, but a somewhat lesser level of reporting from Senator Gratwick's bill several years ago, what we did at that point was we took the CMS standards, which were for carriers to really self-identify how well they were doing with these pieces of parity. And we reported on that. This looks like it definitely goes beyond that CMS self-reporting requirement. So does that answer your question, Senator?
I think it does. And then when you talk about it would require a fiscal note, I assume you mean it would require an OSR fiscal note, another special revenue fiscal note, not a general fund allocation. Is that right?
That's correct.
Okay. That's helpful as well. So
the other piece, I'm sorry to interrupt it. The other piece that I just wanted to bring up super quick is that I think we've talked about this before at the committee, that we did receive federal funds, a federal flexibility grant, that part of that grant is to look at parity. So both in the checklists that we use to do form filing. So before the forms get out onto the street, and then also in market conduct. So we are developing that expertise. I'm just not sure we would have it in time for this.
In time for this, let me just review in the draft what the timelines are, or ask Colleen maybe to review for me what the timelines are.
There actually aren't any specific timelines in terms of reporting back to the legislature in the draft as it stands now. It talks about what carriers are going to be required to submit to. It's not specific in this draft, but when I to step back and say there is already a reporting requirement on the Bureau of Insurance to report annually to the committee about claims paid for mental health and substance use services. And the draft as it's proposed would ask the Bureau to include this additional information as part of that report. And so I think that I'm not recalling what the specific timeline is in the statute, but you usually receive that report from the Bureau of Insurance in the fall for the previous year's claims information. And so it would be an annual report that the Bureau would take the individual carrier reports and sort of aggregate that and include it in their claims-based report to the committee. They would include this information about parity.
And I recall those reports now that you mentioned them, Colleen, and have found them to be very unactionable, like to have not a lot of information in them that I know how to interpret it or what it means. So this could be a very useful amendment to the substance of those reports, because they tend to just list out the number of claims paid by each of the insurers.
Right.
And I don't know what to do with that information, to be really honest. Representative Tepler.
I wanted to get some more clarity from Ms. Rawlings Secunda on her concern about the focus on mental health parity annually, and what that might prevent them from doing if they had to focus on that annually.
Representative Tepler, are you asking about the reports piece or the market conduct piece?
The market conduct piece.
Okay, the concern that we have about the market conduct piece, which I don't think reading this language would be an annual thing. It would be along with our typical 5-year market conduct exams. We often do targeted exams. Our concern here is that by stating that parity has to be one of the targets, it might not prevent, that's too strong a word, but it might become an issue with another topic that comes down the road.
So in 5 years, if you report to us on mental health parity, or in the 5-year period, which is, I don't know when it's coming up, you're concerned that the next time, 10 years down the road, we might instead want a focus on surgical treatments, let's just say. All right. So do you think that if the Bureau wanted to focus on something else instead of mental health parity, that you could come to this committee and ask them to amend the law within that 10-year time period?
I'm hesitating simply because I'm not an attorney and I'm not in charge of market conduct exams. I think so, but I would like to check internally before being absolutely definitive on that. Mr. Yardley is telling me yes, but it would take time.
Okay, so
I had a, go ahead, Representative Tepler.
Sorry, so if we added perhaps at least in the next report and the one following language to the statute, would that settle you so that 15 years from now that focus wouldn't apply?
I think we would feel better with that.
All right, thank you.
Yeah, I was going to suggest a sunset potentially on this section of the statute, like a 5-year focus on mental health parity and enforcement, and then sunset this provision. What do you think about that, Ms. Rawlings, to kind of?
I think that would give us the flexibility that we're looking for.
Okay.
Because I mean, just because this is sunset doesn't mean we couldn't look at it again, but it does give us, way more of the opportunity to kind of survey the field and see what's the hot button issue at the time.
Yeah. I'm okay with that approach. I think it signals that we're paying attention to mental health parity during the current behavioral health crisis that we're in the midst of, and asking the Bureau to do everything they can to focus on that and give it more attention than it has been given. But then recognizing that may not be the crisis of the day in 5 years, perhaps because we have opened the hood and looked at it and fixed it and made it better at that point. Okay, I think that might be a solution. All right, it is 12:02. Is there further discussion on the committee about this bill? I'm going to suggest that we take a lunch break and then pick it back up after our work session this afternoon. because it feels like we may have a few tweaks we want to make on the draft. Representative Tepler.
Thank you, Madam Chair. And I guess I just want to turn back to Mr. Sultan and ask him whether he thinks that most employers would want their employees to have more access to mental health at this point, as opposed to perhaps other benefits, given what we've seen in the last 2 years.
I don't think that's an issue, Representative Tepler. I think that is just fine. I don't think employers wanted to that access to be so difficult to accomplish, and that's why we have suggested that you look at a sort of a different structure there. And I've suggested Colorado, where they've implemented some zero copays for some preventative and other, primary care stuff that has some specific codes that are easy to administer and actually doable, as opposed to what's out in the bill right now that is very, very difficult to accomplish. So it's not that the end game is a question, it's how you get there. That is the issue for us.
Mr. Sultan, I ask you to send us a link to what you're talking about in Colorado. We'll have Colleen do it as well, but if you have it handy, if you wouldn't mind emailing that over to Colleen and she can circulate it to the committee, that would be helpful.
I will try and get you as much information as I can as soon as I can.
I appreciate that. Okay.
Thank you.
Yep. Thanks. Representative Tepler, does that answer your question?
No, not entirely, because I don't understand how this is perceived of as so difficult for the employers.
It's not for the employer's representative. It's implementing it through the carriers. And it is much more difficult, and far be it for me to second guess how the plans can implement it. It is difficult. And we're trying to warn you of that, so that if you want a situation that is more easily implementable, that we look at these alternatives. And that's what we're asking for. So
and the difficulty is that drafting issue with regard to the applicability of the copay to the deductible.
That's part of it.
What's the other part?
We're now into the weeds of plan stuff. When we have, I think if we went to the Colorado, our different systems that are involved in between various claims, you eliminate that process. So that's one. I'll try and get you some more information, trying to figure it out, but
okay.
All I can say, bottom line is it's difficult. And the folks are doing their best to try to implement, all these different states' regulations, and the one proposed here has been regularly deemed very unworkable. So I'll try and get you the Colorado stuff.
Okay, thanks, Charlie.
Yeah.
Okay. Are there any further questions or comments from the committee? All right, I'm going to look for a motion to table. Does anyone want to table? Representative Tepler?
Thank you, Madam Chair. I move we table LD 1822 till later this afternoon.
Okay. And is there a second? Seconded by Representative Evans, and let's do hands in the box for that. Okay, great. I am going to quickly open a work session on LD 1910. I'm going to move Mr. Sultan back, but I'm going to keep the Bureau folks in place because I suspect we may have questions for them about 1910 or we may not. So I'll just leave them there for the moment. So LD 1910, Colleen, can you remind us where we are and share the draft with us?
Sure. So LD 1910, you had looked at a draft previously and talked about some concerns that were raised about the language with regard to whether or not the additional language would allow a carrier to make a determination of medical necessity. And in response to some of those concerns and discussions with the Bureau of Insurance, the suggestion was made to clarify the language to remove the references to the determination of medical necessity being made by a provider, which was viewed by folks as prohibiting the carrier from making a determination of medical necessity. So the language here has been amended to take out those references. So you'd be left with a provision that would prohibit insurers from denying treatment for mental health services that use evidence-based practices determined to be medically necessary healthcare for an individual 21 years of age or younger. And then it defines evidence-based practices and sort of the publications or the clearinghouses upon which these evidence-based practices are found and published. I do know that you heard from some additional comments you received this morning from representatives of health insurance carriers recommending that the committee add to this definition an including but not limited to. So other types of clearinghouses could be looked at as part of this language. And I think that's your update as far as I understand it.
Great. Representative Tepler.
Thank you, Madam Chair. As the sponsor of this bill, I am completely comfortable with adding the including but not limited to language to the draft of the bill.
Okay. Representative Morris.
If we're ready for a motion, I would move on to pass as amended by
Perfect.
sponsors.
I love it. Thank you, Representative Morris. Seconded by Representative Evans. Is there further discussion on the bill? Seeing none, we'll have the clerk call the roll.
Thank you. Senator Sanborn.
Yes.
Senator Sanborn, yes. Senator Brenner.
Yes.
Senator Brenner, yes. Senator Stewart. Representative Tepler.
Yes.
Representative Tepler, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Bleier.
Yes.
Representative Bleier, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Evans. Representative Evans,
Yeah, yes.
Representative Evans, yes. Representative Matheson. Representative Malorano.
Yes.
Representative Malorano, yes. Representative Morris.
Yes. Yes.
Representative Morris, yes. Representative Quinn.
Yes.
Representative Quinn, yes. 11 members of the committee having voted in the affirmative and 0 in the negative.
Okay, thank you, Anna. All right, so with that committee, let me review where we are. We have 2 bills on our table, 1331 and
1822.
1822. I was going to get there, which we may return to later this afternoon. We have a public hearing scheduled for 1 p.m. and we will take a lunch break until then. Representative Connor, go ahead.
Thank you, Madam Chair. I was curious if I may record my vote that I missed earlier today.
Oh, absolutely. Definitely.
I believe it was for LD 1196 and the motion was ought to pass as amended. I vote yay.
Thank you very much. Thanks for reminding us of that.
Representative Connor, yes. On 1196.
Perfect.
Thank
Excellent.
you.
Thank you, Representative Connor. That saves and a good deal of paperwork. All right. Then with that committee, we will be on recess until 1 p.m. and we'll see folks back here for the public hearing at that time.
Good afternoon. I hope that HCIFS members will come back into the meeting as soon as they hear my voice. Okay, 1, 2, 3, 4, 5, 6. We need to wait on another member. Hopefully we'll get another member shortly so that we'll have a quorum. Oh, we do. We have Representative Morris. He makes us 7, which means we do have a quorum. However, we do not yet have a senator. Is it okay to hold a public hearing without a senator, Ms. McCarthy-Reed?
I think the rule is that you need a senator to start a meeting, and you had a senator this morning, but I can double check when you started. But and you need a senator to vote, but since it's a public hearing, I think you may be okay. But I can pull up the rules to double check that.
Thank you. I just would like to do that before I begin the public hearing.
I did just look back at the rules. A quorum is 7 members of the committee, one of whom must be a senator. A quorum must be present to start a meeting. A quorum is not required to continue a meeting. So I think you would be okay under the rules as I read them.
Thank you. I just need to get into my own committee calendar here one moment. And then I will continue the meeting of the Health Coverage, Insurance, and Financial Services Committee, opening with a public hearing on LD 1982. And we will hear this bill, and then we will probably take a break for corner caucuses so that we can come back and hopefully be able to finish our work on the 2 bills we tabled this morning, just so folks know what the plan is right now.
Representative Tepler?
Yes. Ms.
Before
Kafer.
you start the meeting, we do need permission from the Senate President's office? No?
No, we don't, because this is a continuation of this morning's meeting.
All right. Okay.
If we were going to vote, we would need that, but we are just about to conduct a public hearing.
Okay.
So we are, according to Ms. McCarthy-Reed's analysis,
okay.
We are okay for now.
All right. Thank you.
Thank you. So I will ask Senator Rafferty to please join us and present LD 1982.
I'm just promoting him now, so he should
Thank
be here
you.
shortly.
Welcome, Senator Rafferty. You're on mute, Senator.
Sorry about that. I sometimes don't know if I'm in control or it's on your end, but thank you very much. Folks, good afternoon. My name is, good afternoon, I'm sorry, Senator Sanborn, Representative Tepler, and distinguished members of the Committee on Health Coverage, Insurance, and Financial Services. My name is Joe Rafferty, and I proudly represent the District 34, which includes Acton, Lebanon, North Berwick, parts of Berwick, Wells, and Kennebunk. I'm here this afternoon to present my bill LD 1982, specifically Part B, which has been amended, and I'm hoping that you received that yesterday. Currently with the inflation at its highest rate since the 1980s, many Mainers are at risk of being put in a difficult, vulnerable situation. Some estimates suggest that 26% of all consumers in Maine have a credit score below 670. These folks are vulnerable because they are one unforeseen emergency cost away from having their backs against the wall. And if they're in need of some type of a loan to cover an emergency medical expense, a home repair, they'll not have the option to receive a loan through a reputable lender under current Maine law. This often leaves the 1 in 4 Mainers with a credit score of 670 or less to seek a loan from a payday or a predatory lender. These lenders often charge rates nearly 400% or more of APR. Just to give you an example, in recent weeks, I was contacted by one of my constituents, and she called because she was seeking some assistance. She woke up to broken pipes, running water through her bathroom, and essentially shut down all facilities in her home. Lost her heat. As it turned out, when she called in someone for a repair, her furnace was gone. She needed severe work. So she was reaching out for help. We contacted and went through York County Community Action, which has an office in both Sanford and in Biddeford in York County area. And unfortunately, due to her income, she did not qualify for assistance through that service. So she was in a bind and essentially desperate. And sometimes desperate people do desperate things. And, you know, we're doing our best to try to avoid that. So she was fortunately, when she went to work, she talked with some co-workers about her situation and was very, very fortunate in that they told her of some knowledge that she didn't have previously, that the company sometimes has hardship loans or grants. And so she was very fortunate in that she received a hardship grant from her company. She was able to get her furnace fixed with the help of a local oil company, which came in and did the work on short notice. But this is a typical situation that happens to our constituents. And she could have easily, had her company not been there for her, she could have easily been in a situation of trying to live in a home with no heat, no water. And that's kind of an impossible task, as we all know. But again, had somebody come along, you know, offered her a loan to get these things done, I don't know if she would have signed on. As I said earlier, desperate people sometimes do desperate things. And we want to protect Mainers from being, from finding themselves being in a bind of that nature. So without LD 1982, our constituents are in situations like the one I just shared, and they're left in dire situations. This bill is an attempt to take power away from predatory lenders who take advantage of them and put the power back in the hands of the consumers. While I do ask that you keep more of the technical questions reserved for some of the stakeholders who plan to testify after me, I'm happy to try to answer any questions you might have. And thank you for the opportunity to present this bill.
Thank you, Senator Rafferty. Are there questions from the committee for Senator Rafferty regarding this bill? Senator, I have one quick question. I realize that when we're touched by things that happen to our constituents, and we are at the end of a session, we sometimes want a solution but don't have time to look at all the things that have happened before. Are you familiar with some of the work this committee has done on lending in the past?
Yes. Yes, I am. That came to my attention very recently, and excuse me. So I think that The target area that I was looking at is those folks that are 670 and under, and with an opportunity to secure potential loans. And those would be loans in the area of $2,500 and less. So that was my target area. I'm trying to avoid any damage to any of the work that you folks have done in the past, but just more in terms of offering protections for Mainers.
Thank you, Senator, and I'm certainly very sympathetic with that concern. I see that Representative Evans has a question for you.
Yes.
Thank you, Madam Chair. Thank you, Mr. Rafferty, Representative Rafferty. Just going back, you can just clarify the consumer privacy issue as it relates to the bill.
Well, the consumer privacy had more to do with Part A.
Hey, okay, you're talking about
In terms of those protections, yes. And I'm
Okay,
talking
all right.
about Part B, sir. Thank you.
Okay, thank you.
Yeah.
Okay, seeing no further comments or questions from the committee, I'm sorry, not comments. Oh, Representative Evans. Okay, there we go. We'll thank you for presenting your bill, Senator Rafferty, and I will return you to the attendee space for now, as is the custom of this committee, and we'll ask for those who wish to testify in favor. And I see Senator Jackson, President Jackson, is here to testify in favor of the bill. Welcome, Senator Jackson. Good afternoon, Mr. President.
Good afternoon, Representative Tepler and members of the Joint Standing Committee on Health Coverage Insurance Financial Services. I am State Senator Troy Jackson. I represent Senator District 1, and I have the privilege of serving Senator President. And I'm sorry, I'm sitting here in the Colby campus this afternoon, not driving to be sure, but I will provide written testimony shortly. I wanted to testify in behalf of LD 1982, an act to protect consumers' privacy by giving them greater control of their data and establish consumer protections regarding small dollar loans. Obviously, a lot of that title doesn't apply to what Senator Rafferty's put forward, but I think he did a real good job of explaining why it's problematic right now, and I'd probably like to put more of a face to that. You know, currently. This is not an attack on anything the committee has done in the past at all to try and protect consumers in the state. I think, where we are now, according to Experian, 26% of consumers in Maine have credit scores below 670, and thus are classified as subprime. Under current Maine law, this categorization means that the most reputable lenders are not allowed to offer credit to these consumers. And I can't say that I've experienced that personally, but what I can tell you is that I would probably be one of those people that would have problems if I did need it. My credit score has hovered around 670. I've had a host of medical issues that I couldn't pay in a timely manner, and that has certainly affected me. But what I think about often is putting myself in other people's shoes. Especially right now with heating oil over $5 a gallon. I spent, I think, $450 just last week to put 100 gallons in. If I had to fill my entire tank, that would be $1,300. That's hard to come by for a lot of people. And having the opportunity, I don't think any of us could have planned for something like this to happen. Having that opportunity for people to be able to get a loan, a small dollar loan, in these really challenging times, I think is important. If this committee can make sure that it's structured in a way that the people are still protected, I don't know why we wouldn't want to make sure that people that have a little bit less of a credit score wouldn't be able to do this. And so that's why I think it's important that the committee look at it. Like I said, it's not at all to take away from any of your good work in the past. I think there's just a little slice here of people in this state that are not able to get loans that sometimes they're very much needed for whatever reason. And I'm sure there's a way this committee can make sure that they're still protected by people that would like to gouge them. So that's why I was, very supportive of Senator Rafferty going forward with this. And that's why I hope the committee will take a real look at trying to, make an exception and let people with less than we'd all like to have credit scores be able to take advantage of real problems that they may have in their lives. And with that, I'll take any question. I'll certainly try and get that written testimony into you.
Thank you very much, Mr. President. Any questions from the committee for President Jackson? Seeing none, thank you for your testimony, Senator. And I will turn to others speaking in favor, and we'll call Mr. B.J. McAllister.
Good afternoon, Senator Sanborn, Representative Tepler, honorable members of the Joint Standing Committee on Health Coverage, Insurance, and Financial Services. My name is BJ McAllister. I'm the founder of the Resurgam Group, and today I'm testifying before you in support of LD 1982 on behalf of my client, Opportunity Financial. You've already heard about the 26% of Mainers unable to access small dollar loans, but to put it more plainly, without LD 1982, 1 in 4 Maine families don't have access to a variety of quality, affordable loans from companies that have thousands of positive reviews online and high ratings from the Better Business Bureau. Instead, these borrowers are left with impossible financial decisions, whether it be about transportation or healthcare. These decisions often lead to job loss or Mainers going to predatory lenders that prey on Mainers' desperations that aren't subject to Maine regulation. For this reason, just last week in their annual report, the Congressional Black Caucus outlined that policies that limit access to credit are damaging. Quote, instead, policymakers should focus on enacting policies that stop predatory practices and enable consumers to have access to affordable quality credit while curbing the practices that cause harm. LD 1982 would do just that. This legislation expands access to reputable credit while also banning the predatory practices that many lenders seek to impose on desperate Mainers. Those protections include, but are not limited to, banning prepayment penalties. That means consumers can pay their loans early and save on interest without facing a penalty. Requiring lenders to access the borrower's ability or to assess the borrower's ability to repay. And that's because we want to make sure that lenders are not seeking to trap borrowers in a never-ending debt trap, but instead are lending to consumers where there's a path to getting the loan paid off and rebuilding credit. And finally, limiting the number of loans. While a borrower may be able to pay off a single loan, if they start to pile up, that can cause problems for the consumer. It's a practice that many predatory loan providers depend on. In short, this bill is designed to ensure that credit access remains available to those who need it in Maine, while ensuring that they're protected from predatory practices. We ask that you support LD 1982. Happy to take any questions.
Thank you for your testimony, Mr. McAllister. Is there anyone on the committee with a question? Seeing no questions. Oh, I do see a question. Yes, Senator Sanborn.
So, Mr. McAllister, my understanding of what the implication of the bill would be is that it would allow fintech companies to piggyback on national bank charters and use those to evade our consumer protection laws and restrictions on interest rates. So you've characterized this as a benefit to consumers if we allow for this kind of piggybacking to occur, which we banned just the last year in Maine law, although the federal government has also taken some actions to crack down on this at various points. So can you speak to why you think that's good for consumers in Maine for us to allow a fintech company to go around our consumer protection laws? Can you speak to that?
Yes, thank you for the question. When it was, in our conversations with Mr. Lund, it was brought to our attention that that may be an unintended consequence of the bill. And that's why we encouraged Senator Rafferty to submit the amendment that he submitted that requires fintech providers to register with the state. To be completely honest, what we hear from our customers is that their low credit score makes it so they're not likely to want to walk into a bank and be rejected. And so oftentimes they use fintech providers because it's a safer space for them to find out what kind of loan they can access from the comfort of their home. And so our goal is to provide that as an option to the 1 in 4 Mainers who right now need access to credit. And our goal by requiring lenders to register with the state would be to prevent any kind of workaround as described.
Can I have a follow-up, Madam Chair? So the bill as written requires registration, but I'm not clear that that brings fintech companies under the supervision of the department as supervised lenders. Is that your understanding, that they are now a supervised lender and subject to all the restrictions of state law?
The goal of the amendment is for them to become a supervised lender. If it's not doing that, we'd be happy to work with the committee to make sure that would be the case.
Okay. So if they are in fact subject to all the same consumer protection restrictions under your proposed amendment, I don't understand why why there's an access to capital issue. I guess that's the piece that I'm not totally understanding. My understanding was you need to charge interest rates that are not allowed under Maine law in order for the business model to work. And that's why you're piggybacking on these national bank charters to evade state regulation as a supervised lender. So perhaps you can help me understand better how the business model would work if you're giving out subprime loans that our local banks and credit unions would not give out because they would not feel they could under our current consumer protection regime, which is what I understood you to be saying. And certainly if our local banks and credit unions wanted to develop online products that felt less sticky or uncomfortable to Maine consumers and thought there was a market for that, they could certainly do so. But we have not heard that there is a need for that from anyone except the fintech companies. So perhaps you could speak to why this is an access to capital issue if the interest rate is going to be regulated by Maine law.
Sure. So I would say, first off, there's definitely a need. Since the law that was passed last session went into effect, we've had over 400 applicants in Maine looking for access to small dollar loans. Those are 400 people who couldn't get the capital that they needed in a time of desperation. But second, it's specifically the PEI test that makes it difficult for fintech companies because they spread the risk across different lenders. And so that inability to do that because of the PEI test makes it so they can't operate in the state.
I'm not sure I know what PEI.
The predominant economic interest. Apologies.
I'm not sure you answered my question about interest rate.
I'm sorry, I must have misunderstood your question, Senator. I thought your question was as it relates to what makes it so the fintech companies aren't able to operate in the state right now. And the difficulty for fintech companies is that predominant economic interest test, because they work with partner banks. They're kind of a broker of sorts who work to provide a platform for people to access credit.
Mr. McAllister, before you go on, could you, I don't, somehow when you introduced yourself to the committee this time around, I missed who you're representing here.
Sure, I'm representing Opportunity Financial.
And they're a fintech company?
That's correct.
Thank you. And Senator Sanborn, are you done or yes? Okay. Any other questions from the committee? Seeing none, Thank you very much for your testimony, Mr. McAllister. I have no one else on my list who wishes to testify in favor of this bill. Is there anyone in the attendee space who wishes to testify in favor of this bill? Please raise your little electronic hand. Okay, seeing none, I'll move on to those testifying in opposition to this bill, and we'll call Frank D'Alessandro of Augusta. Welcome, Mr. D'Alessandro.
Thank you. Good afternoon, Senator Sanborn, Representative Tepler, and members of the Committee on Health Coverage, Insurance, and Financial Services. My name is Frank D'Alessandro. I'm the Litigation and Policy Director of Maine Equal Justice. We are a civil legal services and economic justice organization, and we work with and for people with low income seeking solutions to poverty through policy, education, and legal representation. Thank you for the opportunity to offer written testimony to you in opposition to LD 1982. This bill would eliminate consumer protections that just went into effect in October of 2021 that ensure that people who lend in Maine have to abide by Maine laws. Last year, this legislature took an important step to prevent some of the worst predatory lending practices by passing Public Law 297, which added important consumer protections by making it a violation of Maine law for a lender to engage in practices to evade the protections provided to Mainers under the Maine Consumer Credit Code. Part B of LD 1982 significantly limits the protections offered to Maine consumers by this law by removing the provisions from law that now prohibit a lender from making, offering, assisting, or arranging a debtor to obtain a loan with a greater rate of interest, consideration, or charge than is permitted by the Maine Consumer Credit Code. It is critical that this language remain in Maine law to prevent non-bank predatory lenders from evading the requirements of Maine law by entering into rent-to-bank schemes with a few rogue banks. Banks are largely exempt from state rate caps, and though these schemes, the non-bank predatory lenders launder loans through the bank to claim the state interest rate limits do not apply to them. These lenders charge triple-digit interest rates and target the financially vulnerable and communities of color and trap consumers in devastating cycles of debt. Maine law limits interest rates to protect its residents from predatory lending. Under Maine law, a 2-year $2,000 loan is limited to a 30% APR. But without the protections currently provided in Maine law, FDIC supervised banks can front loans for high-cost lenders to help them to evade this cap. In 2021, Congress, on a bipartisan basis, passed a resolution to override a regulation that would have exempted predatory rent-to-bank schemes from state regulations. But it's important to note that this action did not prevent lenders from engaging in rent-to-bank practices. It only allows states to regulate the practice. Therefore, it's critical for the legislature to protect Maine consumers with laws prohibiting this practice as currently exist. And I would just like to say these high-cost loans do not promote financial inclusion. Instead, they exasperate financial exclusion. They cannot be justified as providing access to credit. Instead, they trap our borrowers in destructive debt cycles, leaving borrowers with ruined credit and unable to borrow at lower interest rates in the future. And as a result of that, Maine Equal Justice urges you to vote not to pass, at least on section B2 of LD 1982. And thank you for the opportunity to testify on this bill. And I'm happy to answer any questions.
Thank you, Mr. D'Alessandro. I see that Senator Sanborn has a question. Please go ahead, Senator Sanborn.
Thank you, Madam Chair. Mr. D'Alessandro, can you speak to the other section B of the bill, the small dollar loan provisions? I note that they're not really related to the payday lending, the small dollar short-term loan study that we got back from the Bureau recently. It's sort of a whole new class of loans. do you think that we need this provision, and does it, I don't know, is that something we should look at passing? Just stripping out the other part with regard to predominant economic interest, or is this really not a thing that we need to put into main law?
Well, I think that, I mean, there are some really interesting things in that section of the law. I mean, but I think that I know that the Bureau of Consumer Credit Protection is going to testify later. And I think that they would probably be in a better position, since they're the ones who are going to be regulating this new type of loan, to speak to the issue that you just say. I don't want to sidestep the issue, but I guess personally, I would need more information, and maybe this is the type of a section of the bill that should be subject to more study.
I see. Right. Okay. Thank you.
And Mr. D'Alessandro, I'm going to ask a question that's kind of a slightly different form of the question that Senator Sanborn asked, probably in more plain language. Does MEJUP have any ideas for solving the problem that Senator Rafferty is trying to solve, of people with mediocre credit scores who need small dollar loans because of personal emergencies?
So yes, so as part of the governor's package, so this seems like it was forever ago, but in 2020, when the legislature went out of session due to the COVID pandemic, there was the governor did introduce legislation which did provide an avenue for. So what happened was that the state put up, I think, like 500. So basically, the state guaranteed the loan, guaranteed those small loans, and I thought that was an avenue that could be pursued to kind of provide assistance at reasonable interest rates. So you take because many of the people who would get loans like this, most people, I think, would actually be would pay off the loan. So it's not like the government would be spending a ton of money on this, but by guaranteeing the loans, I think that would drive down the interest rates and limit the risk for lenders. I do think that lenders did have some concerns with the specific provisions of that section of the law, but that I think that does provide an avenue to get at this problem. There's also some really great work being done by some credit unions, specifically one of the credit unions in Lewiston that is working really hard to provide loans to people with compromised credit scores.
Thank you very much, Mr. D'Alessandro. I appreciate your considerations. And are there any other questions from the committee? Seeing none, we'll send you back to the attendee space, and we'll turn to others in opposition to the bill. And next I will call Mr. Jonathan Selkowitz of Pine Tree Legal Aid. Welcome, Mr. Selkowitz. Please go ahead.
Thank you so much. Senator Sanborn, Representative Tepler, and members of the Health Coverage Insurance and Financial Services Committee. My name's Jonathan Selkowitz. I'm the managing attorney at Pine Tree Legal in our Consumer and Foreclosure Prevention Unit. I was asked to provide Pine Tree's perspective on this bill by Senator Sanborn. And I apologize, I didn't get time to provide written testimony, but I will. But there's really just sort of 3 points I want to make about what I see in this proposed legislation as it's amended. First, just to I think confirm that what this bill essentially does is it allows any lender who is who's a non-bank lender who's making loans in Maine to evade Maine's interest rate cap by partnering with a bank in a state that doesn't have interest rate caps or has them at something like 300%, and making it so that it looks like the loan is coming from that bank when essentially it's coming from this institution that should be otherwise governed by Maine's laws. That's in section B2 of the amended, and that is the rent-a-bank prohibition that was put into law last year. I don't see any reason why the state of Maine ought to roll back that consumer protection. I don't think that rolling back that consumer protection is going to somehow make the loans that are going to be then used or made under that sort of exclusion not predatory. And frankly, I don't. And while I very much sympathize with the intentions of Senator Jackson, Senator Rafferty of this bill and how it and the goals of it, I don't think it's going to achieve that. And moreover, what it's going to do is open up, I think, a very large loophole that the state tried to close last year. Second, as to the second part of the amended bill, the Small Dollar Consumer Protection Act, I haven't had enough time to really digest it, but I do notice that it seems to do two things. Number one is it defines what small dollar loans are, and it defines it quite narrowly. And then it says we're going to provide all these consumer protections for small dollar loans. And so I worry that while that definition of small dollar loan might cover what Opportunity Financial's products are, it's going to leave open very large door for really high cost, sort of like lump sum due at the end payday loans that aren't, because those won't fit this narrow definition of small dollar loan. So if a loan is made and it's like $1,000 and you just pay interest until the principal is paid off, that wouldn't be covered by this section. And so I don't think that this bill, even if it makes loans available to people who wouldn't qualify them, I don't think it's going to achieve the goal of stopping predatory lending practices at all. And then finally, this question of access to credit, it certainly is a problem. And Attorney D'Alessandro's comments, I think were good ones. And I know other people are thinking about this issue. And I just wanted to point out that this issue of access to credit and the reference to the Black Caucus in Congress of saying we need to make access to credit more available is I think what they're probably referring to is how credit scoring and credit reporting that regime is constructed in the country right now, and how it doesn't kind of sweep in low-income folks and their financial circumstances, and that is something that I know that people are in national advocates are working on, but that is really going to be federal policy. I don't think it's wise for the state of Maine to say we're going to increase access to credit by making it easier to get really troubling and loans for people that aren't going to pay them off. I mean, there's nothing about what's going on in our economy right now that is going to, I think, make it easier for folks to pay off a really high interest loan in a short term, just because it's now available to them. So I really appreciate the opportunity to speak, and I will happy to answer any questions that you have.
Thank you, Mr. Selkowitz, and I'll turn to Representative Evans, who has a question.
Thank you, Madam Chair, and thank you, Mr. Selkowitz. I found this kind of interesting. Help me understand, and it kind of leads back to something that Senator Sanborn brought up. The predatory lenders are being fed by a larger company, just so to speak. are there any penalties in statute for allowing that to happen, or if that does happen?
It's a really tricky question, and my understanding of it is that in many states, consumers have sued lenders for saying, even though my contract says that I'm getting the money from a bank in South Dakota, really I'm getting it through your company. You are licensed to in my state that has an interest rate cap that's much lower than what you're giving me, and it's under those kinds of. I think that is how that is played out, and it's possible that states' attorneys general can try to go after that kind of thing, but it's been one of these issues that is a little unresolved. Last year, there was I think it was the Officer of Comptroller of Currency had a proposed rule, federal rule, to enshrine that you could do that you could do that without, and was no problem with it. And that rule never made it into effect because it was killed when the administration changed over.
Okay, thanks. That helps me a lot. I appreciate it.
Are there any other questions from the committee for Mr. Selkowitz? Seeing none, we appreciate your testimony. And we will next turn to Megan Sway of the ACLU of Maine. Also testifying in opposition to the bill.
I actually don't see Megan any longer, although I saw her earlier in the attendee space. So I'm not sure if she had to drop off for some reason, maybe to go to another committee.
Okay, well, we'll look to see if she comes back. I see that Senator Sanborn wants to make a comment of some kind.
I was just going to say that she may have not gotten the memo with regard to Part A of the bill. So it's possible that she was intending to testify on Part A.
Thank you. Okay, so those are the folks who were signed up to testify in opposition to the bill. And I'll turn to those in our attendee space to see if there's anyone else who wishes to testify in opposition to the bill. And seeing none, I will next turn to those testifying neither for nor against the bill, and we'll call Superintendent Lund of the Bureau of Consumer Credit Protection. And I do want to call the committee's attention while Superintendent Lund is coming through to testimony from our Attorney General, Mr. Fry, and from Robert Caverly, both of which are in writing. Welcome, Superintendent.
Thank you very much. Sorry for the electronic delay.
The wormhole is unreliable. We never know how long it's going to take.
Senator Sanborn, Representative Tepler, and members of the committee, my name is Will Lund, and I serve as Superintendent of Maine's Bureau of Consumer Credit Protection. Our agency is taking a neither for nor against position on LD 1982. I've prepared the comments based solely on the amended version of the bill, and it is styled as neither for nor against because I believe these issues are policy decisions best made by the legislature. The bill before you, as you've heard, would repeal a portion of the law that has been in effect for about 6 months. That provision, part of LD 522, was enacted into law as Chapter 297 last session. It addresses the concept of what's called the true lender principle. Under Maine law, an entity is considered the lender if the, quote, totality of the circumstances indicate that the person is the lender and the transaction is structured to avoid the provisions of the Maine Consumer Credit Code. The situation arises because certain lenders, such as nationally chartered banks, are exempt from state rates and loan limits. So the financial technology companies, called fintechs, partner with those banks develop lending products that may exceed state limits, and then often take possession or control of the loans after the banks have issued those loans. Current Maine law states that a fintech entity that designs, arranges, or assists a consumer in obtaining one of these loans may itself be considered the true lender. And for that reason, the preemption authority of the national bank would not be effective. In other words, the loan terms would need to comply with Maine law under the current version of the law. Fintech companies say this cuts off a source of credit for our state's consumers. Consumer advocates, as you've heard, take the position that this credit is being offered at rates and terms that this legislature has decided would put vulnerable borrowers at risk. It's important to note, as you've also heard, that the bill does not impact payday loans, which are very short-term single repayment loans. Rather, the bill in subpart B3 establishes the small dollar loan definition, $2,500 or less, with a term of between 3 and 12 months, repayable in equal installments. It would limit the making of these loans by imposing certain conditions, including a 3-day right of rescission and a requirement that an existing loan not be refinanced until a previous loan was at least 50% repaid. That's the end of the prepared testimony, and I would be happy to answer questions.
Thank you very much, Superintendent. Not seeing any hands up immediately, I have a question. What do you think about Mr. D'Alessandro's suggestion that a possible solution to this problem is state guaranteed small dollar loans? And what was your experience with the governor's proposal to do that for at least a short period of time?
Thank you for the question. I think that program was designed to operate through Maine's banks and credit unions, which are not under this office's jurisdiction. They are, so it may be that you'd want to ask Lloyd LaFountain or John Barr or Gordon Lorendo about how that program operated. With local banks, a credit score is not magical. And so I think credit scores are an indication. If these loans are not being made, it means that local lenders are deciding that if they made the loans, they wouldn't be repaid in a reliable manner. I mean, that's what a credit score is all about. And so I think a guarantee, if in fact, I think that would be a very interesting approach, a good approach, and I'd be interested in hearing the results in terms of volumes of loans made and what the experience of lenders was based on that guarantee. There also are a number of supervised lenders who are licensed currently to make personal loans. A company called One Main, without an E on the end, is a national company, but it has offices in the state of Maine, and they make what have always been known as personal loans, unsecured loans.
Thank you for that, Superintendent. Any other questions from the committee for Superintendent Lund? Representative Arford, please go ahead.
Yes, thank you so much thank you, Madam Chair, and thank you, Superintendent Lund, for being with us. I'm just curious, do you have any sense of the range of the interest charged on the loans you were just referring to?
Maine law is actually quite generous in terms of the limits for unsecured loans. The interest rate that is still compliant with Maine law can go as high as 30% on the smallest of loans. In addition, there's something called the minimum finance charge that allows, for example, on a loan in the range of $75 to $250 to be charged a flat $15 even for a day or two or a week, which the numbers wise can equate to a high APR. So I think it's my view that this is partly related to the interest rate caps. I think the fintechs would like to be able to, fintechs have told me that they would like to see that 30%, a 36%. The 36% in other states is that additional range is what they would need to be profitable. beyond that, I think there are a lot of other aspects of being regulated that, in addition to the interest rate, but I would have to look at the contracts being provided to see whether there were any other provisions. There are limits on late fees and interest limits on application fees, that sort of thing. But I believe I've been told that nationwide the fintechs feel that they, in order to make loans and be considered the lender, they would need an increase from the current 30% up to the range of about 36%.
Thank you.
Thank you again, Superintendent. Are there any other members of the committee with a question for Superintendent Lund? Seeing none, we will send you back to the attendee space. And thank you for your testimony. And I don't see Ms. Sway having returned, so perhaps Senator Sanborn was correct. I know that Representative Evans wanted me to repeat something I had said earlier, and I was just referring to the written testimony that's available on our website from both the Attorney General and Mr. Caverly of the Maine Credit Union League. Yes, Senator Sanborn.
I'll just note for the committee that the Attorney General's testimony is only with regard to Part A of the bill, which has been struck by the sponsor. So it's really just the Credit Union League that's relevant to the amendment that we have before us.
Thank you, Senator. So is there anyone else in the attendee space who wishes to testify on this bill, neither for nor against? Seeing none, I'll bring to a close the public hearing on LD 1982, and will tell everyone that the committee will take a break for corner caucuses at this time, and we'll return. It's now 1:54. We'll return at, is 2:30 enough time, folks, do you think? Okay, so we'll return at 2:30 to continue our work session and discussions on the two bills that were tabled this morning. 1882, and I'm sorry, I can't remember what the other one is. Does anybody, can somebody fill it?
1331.
1331 and 1882.
1822.
Oh, 22, thank you. Thank you very much, Ms. Kayford, I appreciate it. All right, everyone, so we'll see you at 2:30.
Good afternoon, folks. I'll let anyone listening in on YouTube or in our attendee space know that we do plan to hold a work session on LD 1982 this afternoon, in addition to the other two bills that we tabled this morning and intend to work on this afternoon, 1331 and 1822. Colleen, do you have language review for us today, or are we going to do that one next week?
The only language review I have for you this afternoon is the budget letter report back to the Appropriations Committee. I don't have anything else. So that's one thing you could talk about, whether or not you want to have a meeting to do language review on other bills that you voted this week. I am still waiting on a number of fiscal reviews on amendments that you've previously looked at the language for, but I don't yet have the fiscal, and I don't think you would have them, you know, it's likely you won't have all of them, may not have any of them for next week. So you might want to think about when and if you might want to do language review in person, or whether you want to do it through email, which you've done in the past as well. So.
And we also have one more bill in our possession, I think.
That's correct.
And so our tentative thinking was that we might schedule one day next week to do whatever language review we have, and then also to take up that one bill we have left in our possession. Assuming we get through today's votes, but I think we will.
That sounds good. We do have to ask permission to the presiding officers, and they are asking for us to just specify a date. So think about which, I guess Thursday there's session. So either Tuesday or Wednesday, whatever you think.
Right. I'll let you know. Representative Connor.
Thank you, Madam Chair. I know I'm really low on the totem pole of priorities, but if it's possible, could you touch base with Senator Claxton? We have a budget bill or vote that we're having next week in HHS, and I would really like to be at both if possible.
Absolutely. Yep. I would be happy to do that. And I think our meeting will be very brief, so I don't anticipate it'll be a long meeting. So we'll chat with Colleen, and I'll have her coordinate with the analyst in HHS because they'll have good scheduling info for us.
Thank you. Thank you. I appreciate that.
Absolutely. I appreciate the request, Representative Connor. Okay, I'm just waiting for a couple more videos of cameras to turn on, and I think we've got most of the team here. Representative Tepler, Representative Morris, are you with us? Not yet. Okay, we'll give them a minute. There's Representative Tepler. She's eating her lunch. Okay, that's fine. Sorry to interrupt. Perhaps Representative Morris is as well. All right. So with that, I'll make the announcement again on mic that we are going to hold a work session on LD 1982 today. We'll do that at the end of our work today before we adjourn, so that we have time to get the word out to folks that we are going to take that back up today as well. So with that, I'm going to pick up LD 1331, and I'm going to look to the committee for a motion on LD. Oh, we have a motion on 1331.
You do have a motion.
Which could be an issue. Do we know who seconded the motion? Because I assume Trey made the motion, right?
Yes, I have my notes have Representative Connor seconded that motion.
Okay. Representative Connor, I'm going to ask if you were interested in withdrawing your motion so that we could have a different motion.
I would agree to withdraw that motion.
Excellent. So then I'll look to the committee and ask if there is a motion. Representative Tepler, do you want to make the motion? Go ahead.
Since the sponsor isn't here, I'm happy to make the motion. And the motion would be that we move to from a up to 3. Am I on the right bill? 1331? Yeah, okay. We change our current standard of the amount that ratings can differ from currently 1 to 3 to 1 to 1.25.
I think it's currently 1 to 5. Isn't that right, Colleen?
Yes, it is.
That's why I
Oh,
switched
okay.
that you, Representative Tepler, was just because right now I think it's 1 to 1.5 and we would move it to 1 to 1.25.
25.
Yes, 1 to
1.25.
1.25 is where we're headed in any case.
Right.
And there was another piece to that which I may need a reminder of.
Implementation date.
Implementation date was 1/1/24.
1/1/24.
Yes,
Okay.
1/1/24.
And the other piece of it, I think, was a report.
Right. We would like to have the report in that's supposed to come from the Bureau of Insurance to come back to us on the results of this and also on the rest of the Wakely study.
Right. So it would be a report back, I think, with a date of in December. We'd like to have the report back and with authority for the committee to report out a bill related
in January of
in the 31st.
I will second all of that.
Colleen, did you get all of that? Do you have
I
questions?
missed, the only thing I missed is when did you say you wanted the report back?
December.
September? No, what did you say?
December.
2022.
December.
December. Okay, thank you. But the 131st would have the authority to report out a bill. Yeah,
Correct.
got it.
Yep. That gives us the information early in the session. I think this year we got quite backed up with getting a lot of reports very late in the session. It'd be helpful if we'd get it really early in the session so we could report out a bill right at the beginning.
Yeah, if I suggest, if you wanted to suggest sort of December 1st, that would likely be before cloture for the next legislature. So any individual committee member could respond to.
Okay, sure, let's do that.
That and speed things up potentially, as opposed to waiting for the report to come and be considered and then the committee then reporting on a bill.
Okay, yeah, let's do December 1st, and then that gives the opportunity, particularly for very interested legislators in high cost counties, to put the bill in if they wanted to do that themselves.
Right. Okay. So ought to pass as amended 1.25, 1124, and then the reporting. All set.
Great. Okay, is there any further discussion on the motion? All right, I don't see any, so I'll have the clerk call the roll.
Thank you. Senator Sanborn.
Yes.
Senator Sanborn, yes. Senator Brenner.
Yes.
Senator Brenner, yes. Senator Stewart. Representative Tepler.
Yes.
Representative Tepler, yes. Representative Alford.
Yes.
Representative Alford, yes. Representative Bleier.
Yes.
Representative Bleier, yes. Representative Brooks. Representative Connor.
Yes, sorry. Yes, I.
Representative Brooks.
Yes.
Representative Brooks, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Matheson. Representative Malorano.
Yes.
Representative Malorano, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Quinn. Representative Quinn. Your mic is off.
Yes, could you hear me that time?
Yes. Representative Quinn, yes. 11 members of the committee having voted in the affirmative, 0 in the negative.
Now my mic's off. Thank you, Ms. Kayford. Great job on this bill, committee. I think we got some good work done. Okay. Next, 1822, we'll open a work session on LD 1822. I guess I'll just start by saying that we heard the concerns with regard to counting copays toward the deductible in the large group market, and that there isn't really a precedent for that, and it's sort of a strange artifact of our made for Maine law, but that law has been in place for a few years in the merged market or in the individual and small group market, so we don't really want to upset that. So our suggestion was that we redraft the provision to separate out the large group into a separate subsection and then remove that deductible language from that separate subsection. So the language would be parallel, but would not have that strange accounting for the deductible piece that would be taken out. We would adopt the suggestion of not greater than that was made rather than equal to for the copay. And we would add the confidentiality provision to the Kennedy Forum Act language that's in the second part of the bill, as well as a 5-year sunset on that part of the bill. So it would just that whole part of the bill would go.
The whole section.
Yeah,
the
whole section
whole section would be repealed in 5 years. Yep, great. Thank you. That was one question I had. So.
Yep. So that's what we discussed. I'll make that a motion and look for a second. Seconded by Representative Tepler. Is there further discussion on it? Representative Morris.
Thank you, Madam Chair. Just further clarity, clarification. So there would be parity as far as they would have to cover within the large group, but it would not include all the language around co-pays and all that.
No, it would. So it would include, it would have the same language around, your behavioral office visit and your primary care office visit would be, the first one would be no copay. The second two would be copay but no deductible, and after the third visit, the copay for a behavioral health visit would be no greater than your copay for your primary care visit. So I think it doesn't include that problematic language about applying copays toward your deductible, which is very unusual and strange, and there's no systems for that. But it does mandate a plan design that would require some ability to access those primary care and initial behavioral health visits without any out-of-pocket or without going to the deductible first, to the extent it's not an HSA designed plan. So that piece would be similar. I don't believe that's hard to implement. Those are just plan design things that are pretty straightforward to implement. The difficult piece to implement, as I understood it, was the weird accounting for the out-of-pocket costs of copays that is currently in our Made for Maine healthcare plan.
Right. Okay. I think I'm good.
You're all set for now. Okay. Is there further discussion on the committee before we move to the vote? No. Okay. All right. I'll just say for the record that I think this is, again, it's incremental progress. We're not eliminating copays, which was the original bill. But I think what we're doing here is just a little bit more protection. I looked at my employees' plan and found that primary care office visit would be $35 and a behavioral health office visit in the same plan would be $70. And one of those visits would be with an MD, presumably, or an NP or a, PA or someone. And the other would be with an LCSW. And it seemed very strange, potentially. And it seemed very strange to me that there would be such a cost differential in those two types of visits. And that behavioral health would be so much more difficult to access as a result. I know I would think twice before going to a counseling visit if it was going to cost me $70 to do it. So I think this could really bring some needed relief for employees like mine of small businesses that have those very high copays that they have to tackle in order to access needed mental health care. So I hope that we can support it, and I think it'll really help chip away at what is a real huge crisis right now for Mainers. Representative Arford.
Yeah, thank you so much for that. I agree with everything you've said. The only thing I want to add is to thank Representative Morales for bringing this bill to us, the original bill, because I think we have done something that's moving the dial in the right direction as a result, even though we're not able to capture her, obviously, the full intent of the bill.
Thanks. Any other comments? All right, seeing none, I think we're ready for the vote. Go ahead, Edna.
Thank you. Senator Sanborn.
Yes.
Senator Sanborn, yes. Senator Brenner.
Yes.
Senator Brenner, yes. Senator Stewart. Representative Tepler.
Yes.
Representative Tepler, yes. Representative Alford.
Yes.
Representative Alford, yes. Representative Bleier.
Yes.
Representative Bleier, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Matheson. Representative Malorano.
Yes.
Representative Malorano, yes. Representative Morse.
Yes.
Representative Morse, yes. Representative Quinn.
Yes.
Representative Quinn, yes. 11 members of the committee having voted in the affirmative, 0 in the negative.
Great. Thanks, everyone. All right. So next up, and I think our last work session for the day is LD 1982, which we just heard the public hearing in about an hour and a half ago. And I'll look to the committee for a motion. Senator Brenner.
I want to thank the bill sponsor for bringing this forward. And I don't think this is the direction that the committee wants to go in at this time. And so I'd like to move an ought not to pass motion for this bill.
Thank you, Senator Brenner. Is there a second? Seconded by Representative Tepler. Is there any further discussion on the bill? Seeing none, we'll move to the vote.
Thank you. Senator Sanborn.
Yes.
Senator Sanborn, yes. Senator Brenner.
Yes.
Senator Brenner, yes. Senator Stewart. Representative Tepler.
Yes.
Representative Tepler, yes. Representative Alford.
Yes.
Representative Alford, yes. Representative Bleier.
Yes.
Representative Bleier, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Matheson. Representative Malorano.
Yes.
Representative Malorano, yes. Representative Morse.
Yes.
Representative Morse, yes. Representative Quinn.
Yes.
Representative Quinn, yes. 11 members of the committee having voted in the affirmative, 0 in the negative.
All right. Thank you very much, Ms. Caford. And Colleen, I think you're up to do our language review on the budget. memo.
I did too. I'm gonna pull that up. So this is the memo that reflects the committee's votes on Tuesday. There were 9 members present for the first vote on 4 initiatives, 10 members present. I know Senator Sanborn, you weren't there. I don't know if you want to register your vote. I can include that if you'd like. And perhaps Representative Flyer wasn't there for the first votes related to the initiatives in the Department of Administrative and Financial Services. But otherwise, the committee's votes were unanimous on all of the initiatives. So the memo just outlines that there were 4 initiatives in DAFs related to administration of employee benefit plans. The initiatives, 1 added a new position in the Office of Employee Benefits. It increased a part-time position to a full-time position, was the second initiative, and the final 2 initiatives provided funding for approved reclassifications. All of the funding was actually reflected a reduction in general, in the general fund. It's all funding in the what's called the accident, sickness, health insurance internal service fund, which is supported by sort of payments that other state agencies make to DAFs to support the employee benefits, the administration of employee benefits. So it comes out of their sort of general fund budgets, and then it's transferred over to DAFs to cover that. So that's that. It's not any, does not require any new general fund amounts. The second set of initiatives related to the Department of Professional and Financial Regulation. 1 initiative adding a specific headcount for 1 principal consumer credit examiner position and to adjust some funding between programs. That was the funding and the creation of those positions was made during prior legislation that was considered by the committee related to student lending, the oversight of student lenders. And this just sort of corrects that the fiscal note in the previous legislation didn't include the specific headcount and allocated funding to the wrong account. There's also an initiative to provide funding for reorganizing a position within the Board of Dental Practice. And there is 1 statutory language provision which designates the position of the Director of the Office of Affordable Health Care to the list of positions that with salaries set by the governor. Committee also voted in support of that. The second piece the committee discussed was adding to the memo a recommendation that the Appropriations Committee consider including the substantive provisions of LD 1390 in the supplemental budget. That's a bill that was considered by the committee last session. It's currently tabled on the appropriations, special appropriations table. And so the recommendation is that the Appropriations Committee consider incorporating it into the supplemental budget. It would need some changes to reflect the passage of time, sort of moving forward the implementation date to the next tax year in changing the reporting date. So I did mark up an amendment, which I will show you really quickly, that can be attached to your letter to the Appropriations Committee if you would like. So it really just makes the changes to the dates. This is the reporting date that there would be annual reporting after the first year about sort of the results of the program. And then secondly, that the checkoff box that would be included on the tax form would be for tax years beginning on January 1, 2023. The original bill proposed that it happen this past January. So we need to make that change. And then additionally, the Appropriations Committee would be required to, if they do move forward with this, have the Office of Fiscal and Program Review update their fiscal impact and fiscal note on the original bill. So that's the budget proposed letter for the committee. If that looks okay, we can finalize that and get ready to send to them on Monday is our reporting date back to them.
I would like to have my vote added to all of the unanimous votes.
Great.
So I appreciate that very much, Colleen. Representative Bleier, go ahead.
Thank you, Madam Chair. I also would like to have my vote added as a yes.
Great. Thank you. So for the first piece, we had 10 members, 11 members voting on all of the initiatives. So let's see. And Senator Brenner, you were another one who wasn't here when we took these votes. I think if you'd like to register your vote, I can include you.
Yes, please. I'd like to register mine with the unanimous report as well. Thank you.
Great.
And Representative Arford wanted to say something.
Yep.
First of all, I want to thank Colleen and everybody. I think this year was a really smooth process. The only thing I'm wondering about, does the update on the fiscal note, that obviously includes us asking them about including that huge chunk of change to cover new main care members? Or Denise, have you already spoken to them and worked that through? Or where are we with that part?
I'm sorry, I didn't understand what
I was just checking in on our discussion around at least either the fiscal note or the part that was in the bill included a huge chunk of change to cover new main care members that resulted from the easy enrollment. And we all agreed that that was really out of line. And either Denise, you were going to talk to them or we were going to do something about that. And
I did speak with the fiscal office. I spoke with Mark Sear and Luke Lazar, who had written the fiscal note. They're unwilling to change the fiscal note. However, they pointed out that if we pushed the effective date out, that in this fiscal year, there would be no cost to begin the process. And in the next fiscal year, it would only be in the $200,000 range. It's only in the out years, the far out years, that the estimated cost goes up. And it is an estimated cost based on people checking off the box, going in and actually being assigned to main care. So, you know, it's something that we don't know what's going to happen with that, but these are people who are actually eligible for main care now. And we hope that if they're eligible, they get themselves insured through main care. Because otherwise they're uninsured and they're relying on charity care.
so that's not going to prevent the appropriations committee for funding the small amount now.
It will be zero in this fiscal year. So that's up to us to send that message to the appropriations committee that we would like to see them move forward with us.
Yeah, thank you. Thank you for taking care of that.
No problem.
And I also want to thank Representative Evans for bringing this bill. Personally, this is one of the bills that I feel best about because I think it really will make a difference. So thank you, Representative Evans.
Well, thank you guys for your support. I think it's going to make a big difference in a lot of people's lives, especially now that we have our own state-based health program. So we still have too many people falling through the cracks. So those are the ones that I'm most concerned about.
Representative Tepler.
Thank you, Madam Chair. I just want to say that I'm very proud of the work this committee did today. That we've been told there's a behavioral health crisis. We're all concerned about it. We've been hearing from our constituents about it. We are hearing about the people stuck in hospitals. And, you know, we've done what's in our power and is reasonable to help with that problem today. And I'm really pleased about that and thank everyone. And I think even reducing the differential in the rates for Northern Maine could make a difference in the behavioral health crisis as well. So good work, gang.
Great. All right.
That's all I had.
Representative Brooks.
Yeah, I just wanted to thank the people on the committee as well. This is my final term and I really have enjoyed working on this committee. Colleen is very, very expert, knowledgeable, and all the members of the committee are as well. Special shout out to our chairs, and Edna, our newest member, has done a fantastic job as well. So I wanted to add that.
I agree. And this won't be our last meeting, so we don't have to say our goodbyes. We're gonna have one more meeting, whether on Zoom or in person. So I will definitely will let the committee know as soon as we figure out what the right timing is to schedule that. And we'll meet one more time, and hopefully this year we'll also get to have a little committee celebration after we adjourn. That would be my goal. I happen to know a really good place to have a little celebration, and we haven't gotten to have one at Rising Tide yet in all of my 6 years on the committee. So I'd love to host everyone before my stint as chair of the committee is officially over. So we'll work on organizing that at some point after we adjourn from what is inevitably going to be a very busy April in the legislature. So something to look forward to. Okay, Colleen?
I just have one more thing. I just quickly, do I have your permission to send up a memo and initial your name, your initial for you, to asking permission to meet one more time next week?
Yes, except I don't know which day to tell you to.
I won't say a day. I'll just say one more meeting, and hopefully that will be enough for them. I think it will.
Okay, that's perfect. Yeah,
perfect. Thank you.
Thanks. Okay. Thanks everyone. Get outside. It's ridiculously gorgeous out. So please exit your office and go outside as soon as possible. That's my plan. All right. Have a good afternoon, everybody.
Thanks, everybody. Be safe.
Representative Morse, you want to sign off?